Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome. And what might it do when you start?
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us lead our earth together. Welcome to the brand new world.
Global Namaste. Please join us this Sunday on a free global online episode, Integrated Health, Transforming Healthcare.
They can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome. And what might it do when you start?
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us lead our earth together. Welcome to the brand new world.
Global Namaste. Please join us this Sunday on a free global online episode, Integrated Health, Transforming Healthcare.
They can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome. And what might it do when you start?
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us lead our earth together. Welcome to the brand new world.
Global Namaste. Please join us this Sunday on a free global online episode, Integrated Health, Transforming Healthcare.
They can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome. And what might it do when you start?
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us lead our earth together. Welcome to the brand new world.
Global Namaste. Please join us this Sunday on a free global online episode, Integrated Health, Transforming Healthcare.
stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us lead our earth together. Welcome to the brand new world.
Global Namaste. Please join us this Sunday on a free global online episode, Integrated Health, Transforming Healthcare.
They can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us lead our earth together. Welcome to the brand new world.
Global Namaste. Please join us this Sunday on a free global online episode, Integrated Health, Transforming Healthcare.
They can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us lead our earth together. Welcome to the brand new world.
Global Namaste. Please join us this Sunday on a free global online episode, Integrated Health, Transforming Healthcare.
They can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us lead our earth together. Welcome to the brand new world.
Global Namaste. Please join us this Sunday on a free global online episode, Integrated Health, transforming healthcare.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us lead our earth together. Welcome to the brand new world.
Global Namaste. Please join us this Sunday on a free global online episode, Integrated Health, Transforming Healthcare.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hands. Let us lead our earth together. Welcome to the brand new world.
Global Namaste. Please join us this Sunday on a free global online episode, Integrated Health, Transforming Healthcare.
Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Global Namaste. Good morning, good afternoon, and good evening to all the lovely viewers at Healing Our Earth. I am your host, Amrita, and I welcome you to today's episode of Integrated Health. Before we dive deep into this episode and talk more what it is about for each of you to know what new we are going to talk in today's episode, let's start with a short prayer. I will be chanting Gayatri Mantra. You can hold any affirmation as you like. So let's get started. Closing your eyes, taking a deep breath inside, pausing for a while. Your thoughts, your breath going slow, and let's chant. Om. Om Bhurbhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayam. Om Bhurbhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayam. Om Bhurbhuvasvaha Tatsaviturvarenyam भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। ॐ शान्ति शान्ति शान्तिः। With these words that always hold us and the peace that we integrate in our life not just comes from the physical realm of our life, but also from many other places. The mental, the spiritual, the emotional, and all these things connect us together to think about what is health. And that's why today's episode of Integrated Health gives us those facets of health where we can think and know more what all can we adapt in our life for a healthy lifestyle, what all can we have in our lives to get more better, to cure ourselves from diseases and restore health. And that's why we bring to you quite often this episode of Integrated Health, where we have experts from different domains and health professionals that talk about their expertise in the field of health, holistic healing, and wellness and well-being. And to count on that, we have loads of health professionals as well as practitioners who talk about how can we stay healthy by adapting different facets of health, like being a chiropractor, being a massage therapist, an acupuncturist, being a qigong and tai chi healer, being an Ayurveda practitioner, may it be yoga meditation expert, or from any domain of traditional medicine, or a hypnotherapist, or any other stuff. We need these things. And the more we know about them, the better we can get and use these facets of life, which the integration of which can help us in knowing about ourselves and filling our lives with happiness in physical, mental, spiritual, emotional, and lot many domains. And that's what is the beauty about integrated health is. When it talks about holistic healing, what is holistic healing? Not just staying healthy physically, but on many parameters. And thus you say, though I am healthy, I also feel good. Though I feel I am strong, I also feel stronger from inside. And what's that inside? What that talks to you? What does that part of you that tells you, yes, you are the one who really is? And that's why this episode of Integrated Health talks a lot about these facets and how to cure them and what importance do they have in our life and how can we use these modalities to cure ourselves and stay better and also bring our family to a new way and a perspective to understand all these things. Though a lot has been done after COVID and people have realized the importance of how important it is to stay healthy and to know about so many parameters where I can adapt diet, nutrition, holistic healing modalities for myself, but a lot more we need to learn. And that's why today we have our episode producer, Dr. Rajiv Gupta, who has produced today's episode, and he will be taking up other guests. We'll be talking more about integrated health forum that has been taken up, and what all new things are coming up in this episode and in the field of integrated health. Global namaste to you, Dr. Rajiv Gupta. A very warm welcome and good afternoon.
It is so great. Thank you very much for Amrita and the whole family of Healing Our Earth. We have been going over almost 5 years now, and it's so good that healing is a term that is connected to health, and health is connected to the well-being, and well-being is connected in an adverse fashion to the disease. So the departure from the disease to the wellness is passing through healing and remedies. And this episode today is unique because over past 10 years, I have been working on combining the modern medicine or Western medicine with the alternative and complementary medicine. I have been
Yeah.
trained as the professional in allopathic medicine or Western medicine, but right from my own childhood, I have learned that there is no cure for every single disease in the modern medicine. So during my medical career, I have spent my summer holidays attending the Ayurveda college and reading there, attending that, learning how I can bring the similarity between the allopathic science and the Ayurveda and yoga. And having done that for nearly 25 years now, I have found what is common principle, because all these pathies, as we talk about, are not just one part. When they go, there is something called final common pathway, and therefore all these have something to contribute. If you think of how medicine, the modern medicine or Ayurvedic medicine or homeopathic medicine or Qigong, acupuncture, they all have something to contribute. Otherwise, they would have disappeared by now. Modern medicine is modern. But before that, these things existed for thousands of years, and they were able to heal, cure, and remedy the people. The question was that the evidence-based medicine, which is the Western medicine, has evolved much faster, much stronger, and much robust. As a result of it, it has taken over the world. And maybe for foreseeable future, for next few decades, it will stay on top. And people revert to it, particularly for the acute episodes, acute illnesses. If you have heart
Yeah.
attack, you're not going to be sitting and doing yoga or qigong or tai chi. But on the other, if you have, so I hear yes. And that's on the other hand, if you have chronic arthritis, if you have a chronic backache, if you have got dementia, if you've got depression, if you've got anxiety, there are plenty of other things. Yoga, meditation, they can just help reduce the anxiety, depression, bring calmness into the life, balancing the sympathetic and parasympathetic system. Same is for chronic pain. Acupuncture has got a strong base on how it changes the nerve pathways and the stimulation of points, which the science does. And I had been fortunate to study that as well to a great extent in it. And I'm glad to say there is. And that's helpful. I myself had sciatica for a period of time and was hospitalized. I was wheelchair bound for a period of time, but I was taking the modern medicine, which is definitely there. I was on opioids, I was on pregabalin, I was on many other things, in addition to non-inflammatory, non-steroidal anti-inflammatory drugs. But I knew the side effects. Taking it for a long period of time, understood. I did manage the alternative medicine. I did went for acupuncture. I went for acute, whatever is called cupping therapy. I tried yoga. I tried my own formulation, super nerve power, which has got the derived herbal or plant derived products in a natural way to get it. And the exercise, qigong, chiropractors, I even went to osteopath to refix me. And this is because I believe in it. When you believe in it, you know you dig deeper in it. And if people feel that I, being a modern medical practitioner with high reputation across the country, can do it in the United Kingdom, I feel it gives power for other people to try and get convinced and do it. And imagine these are all tools in the toolbox. Not one tool is fit for all. When you do screwdriver, the hammer wouldn't work. When you need hammer, the spanner wouldn't work. When you need a spanner, other tool wouldn't work. So all these have got, these are like tools in the toolbox. Let patient have the choice. In real life, currently always say patient choice and patient-centered treatment. Actually, majority of time it's not. People try. When they fail, they go to the second line medicine or other therapies. They try, and they fail, they go to the third one. So I think it's a golden opportunity to kind of join it all together in one platform, for which I'm glad there are quite a few of people, and I'm grateful to those who are ambassadors who have actually committed to help and push this motion forward, so that the public at large, maybe our generation, maybe our future generation, we can change. And this change is going to happen only if we have it all together, so that young people ask in an evidence-based way why it should work. And if we can explain why it will work and when it will work, then bingo, we have won the path. So that's great. So let's talk it through in more detail as that go. But Amrita, what do you think about it? You're yourself an ambassador. What's your thoughts on it? And we can have Dr. Bhushan Patwardhan, if he's here. He is another big pearl
Yeah.
from India,
Yes.
and he's well known. So let's get him. What does he think about it?
If he's there, kindly switch on your video, and I request all the speakers to kindly make their camera landscape and log in by their country name in capitals followed by their own name. Thank you so much. It is easy for us to spotlight that way.
Thank you, Dr. Rajiv Gupta. Somehow I'm not able to get my camera on. Maybe after some time I will have to start my video.
No problem. No
No,
problem.
it is
Yes.
not coming up somehow. But Dr. Rajiv Gupta, first of all, अमृता जी आपने जो शुरू किया गायत्री मंत्र से बहुत
जी
ही अच्छा लगा. That was a very very good start
धन्यवाद
for this kind of a function and conference, you know. And Rajiv ji, actually, you have narrated the whole thing, you know. Means there is hardly anything for me to add on it. But let me tell you that I'm not an Ayurvedic physician. I am not a practitioner. So for me, whether allopathic medicine, and I'm glad Dr. Gupta mentioned it as allopathic medicine, because I don't call allopathic medicine as modern medicine, you know. And we say that it will become modern medicine if allopathic medicine works with complementary medicine or traditional medicine. That will be the future modern medicine. It is conventional medicine. It is orthodox medicine. It was at one point of a time Greek traditional medicine. It worked with science, and therefore it became allopathic medicine. So science and evidence-based, what Dr. Rajiv Gupta mentioned, is extremely important in this. So there is only one medicine, which is evidence-based medicine, you know. And for me, I'll just give you one example. I'm basically a biochemist pharmacologist. I hypothesized in year 2000 that Ayurvedic concept of Prakriti. By the way, till that time, my main focus was discovering medicines from Ayurvedic resources, you know. So I was looking to Ayurveda more as a discovery engine for new medicines. But then I realized that I'm doing injustice to Ayurveda, because Ayurveda is not herbal medicine. Ayurveda's basic concepts, you know, are so fundamental and important. So my way to look at Ayurveda became different, and I started looking at Ayurveda from the science point of view or biology point of view. And my first hypothesis was Ayurveda is a personalized medicine. Remember, this was in 2000. 2000, the Human Genome Project was just on horizon. You know, the term pharmacogenomics was not even in mainstream. Personalized medicine was just coming up. You know, so it was that period. And as a researcher, hypothesizing is not enough. We have to test it. So we had a cohort of rheumatoid arthritis patient, and we know HLA-DRB gene, you know, and its linkage with the rheumatoid arthritis. So we took that cohort and we did a blind study, you know. Rajiv ji, I have talked with him. In this blind study, what we did, we distributed our patients into three groups: Vat, Pitta, and Kapha. As you know, Ayurveda classifies our population into three broad groups called Vat, Pitta, and Kapha. And we then did polymorphism study of this gene, on the first PCR which our university received in 2001. So it is old. But first time we showed that the allele distribution of this gene was statistically different in Vat, Pitta, and Kapha. This was presented before Cold Spring Harbor Symposium on Pharmacogenomics in 2005, and subsequently a new discipline has emerged now known as Ayurgenomics. So this is what is the strength of our traditional knowledge systems, and they are all over. They could be in Chinese systems, they could be in Korean systems, they are all over. So we need to really look at these systems as source of new innovation. What is happening today is we are trapped and we are being told repeatedly that you will get health by taking medicine, which is not true. Health depends on 4 determinants of health, which we teach to our public health students, and they are nutrition, lifestyle, environment, and genetics. These are like 4 pillars. Any one of the pillar gets weak, we give support. So this support is medicine, and which is extremely important. Therapy is extremely important for healing, but that is a support system. So our health actually in our hand. We can decide where to go on to get good nutrition or bad nutrition, good lifestyle or bad lifestyle. Means if you go on having ultra processed food, how can you expect to get health? If you adopt a very unhealthy lifestyle. So essentially, what I'm trying to tell is, please don't look at traditional medicine only from the narrow concept of medicine as material. Traditional medicine brings a great wisdom to tell you what to eat, what not to eat. It tells you what is the good behavior in which season, what season you should. Ayurveda Swastha Vrutta. So non-pharmacological aspect of Ayurvedic medicine or Chinese medicine or Korean medicine or Kampo, non-pharmacological component is, I would say, more important today when we are facing the non-communicable disease epidemic, or lifestyle disease epidemic. So I would not talk more, but I'll just at the end, I'll tell you that rather than protecting our own turfs, today we are busy in protecting our own turfs. So we are like water and gel. Allopathic doctors are not willing to look at any other. But we must understand that although we have made tremendous developments in allopathic medicine, there are still very, very limited scope when it comes to lifestyle medicine. Unless you combine the yoga and other systems, what kind of mental health we are trying to give. The latest data tells in America, CDC data is telling you that more than 60% of the school-going girls are feeling hopeless. Now, where are we taking? Recent study published in JAMA is telling you that the gap between health span and lifespan is widening. Now, what does it mean? Is this the development and advances of medicine? No, we have to look back, and really think what kind of trajectory we have taken. And all these questions I have raised in my new book, which is named as Genome to Om, wherein genome represents modern science and Om represents the ancient wisdom. And we are telling that modern science has to go back to Om to learn the wisdom from it and come on the right track for the global well-being or universal well-being in the spirit of what we call it as Vasudhaiva Kutumbakam, Sarve Santu Niramaya. This is what should be our mission. Thank you very much for inviting me, Dr. Rajiv, and it was a pleasure to get connected with this wonderful group. And thank you, Amruta ji, again. Thank you.
Amazing, amazing. So great. It was lucky we were together in one of the summits, and we exchanged our books. It's like, Genome to Om is quite popular. My book, which is the integration of the modern medicine with yoga and Ayurveda for better patient care, is again so well recognized and is really appreciated, because this is the way everything needs to work together. So again, thank you so much, Bhushanji. I am thinking is that one of the interesting thing is that, and my vision is that a reimagination and the reimagined concept of the patient care is to prioritize individuals' health and overall well-being over the treatment of symptoms, because treatment of symptoms come here on the right side, while prevention of the symptoms, maintaining the health and preserving health is the more important part. And the second concept of this whole integrated health is the patient-centric approach. And that encourages a deep dive into the patient's lifestyle, environment, mental health, and the emotional health being alongside their physical health. And that is the part, that's a complete package. It's the holistic part of the package. And therefore, by acknowledging the interplay between these all elements, the healthcare providers, which include all allopathy, homeopathy, yoga, hypnotherapy, even aromatherapy, music therapy, because all they are important, they can all offer some comprehensive and personalized care plans that we just talked about. And this then address the root cause of illness rather than just managing the disease. So I think that's actually the concept. And I hope that people who are on this seminar, which is global, right from, UK, India, Pakistan, Europe, Philippines, America, Far East, Australia, and India, and many, many, many places. This is so important. I think there are 36 countries attending this, and it's so good that Nil Kumar, who is perhaps not here, has really put emphasis on boosting this. And Nishit, who is actually managing backstage, there is a whole team of people along with him who is joined to make this happen. And we will hear from various people, including some of the ambassadors, some are practitioners, and some are people who from outside are pushing this philosophy so that this become a reality. What would you say?
Exactly. Very right, Dr. Rajiv. In fact, these kind of initiatives that people take and they realize, some of times I have my own personal experiences when people come to their life and they realize this was my profession, but then something happened in my life and I faced certain things. But then the answer to that was not the thing I was practicing or not the things that I was believing in, but I had to trust something else. And when I had to trust something else, it came up to be another stream of the things that has opened a new gateway for me to realize that yes, it is much more than what I was thinking, or much more than I can do in the health perspectives. And why not for me? If it is working, it will work for 1,000 others, and let's open up the gateway. And these things basically gives us the faith of realizing whenever we talk as a health professional, and our relationship with the patient, it is also built on that faith. And same is the concept of having the faith in building up of the treatment plan or treating ourselves and others, which is a very important emotional part of a well-being, which combines that aspect of having that faith that Dr. Bhushan said, from genome to ohm. So it's about the faith of having the realization of existence of science and something beyond science, but both of them are the ones that are the real medicines for us, through which we trust, we believe, and we cure ourselves. And this is really a very interesting episode. Let's move further. Dr. Rajiv, what have you to say? Over to you. Thank you.
So, Amrita, that's great. And you have actually encapsulated it quite well, as was Dr. Bhushan put forward, that we all are in this game and we are trying to make it happen, making just to open the minds of people, open the eyes of people so that people be prepared to look at what else is there. Because many times people have blinkered because they are trained in one way, they just believe that is the right way and they keep going. And they're not prepared to look that there could be a good aspect of some other discipline, which although they're not trained, but they are open to think about it. They're open to try. And I have a vision of a healthcare ecosystem where professionals from a variety of disciplines collaborate rather than compete. And this includes the doctors, nurses, alternative practitioners, nutritionists, mental health professionals, and a variety of other people who have ability to help support and and encourage healing. And such a collaborative environment will then foster the innovation and will allow sharing of knowledge and skills across the disciplines. And I emphasize the word across the disciplines. And that will enrich the healthcare experience for both the healthcare providers with practitioners and the patients. So both sides, the patients will feel more empowered because they don't care what system or pathy it is. They want a cure, they want treatment, they want relief. If they have pain, they want relief of pain. If they have anxiety, they want somebody to sort something out. So this is the thing. So if we have a real patient-centered focus, we are going to be much better. And this ecosystem that we have produced through the integrated health care platform is exactly going to serve the same system. And we're going to have, as the time goes, complex patients which are having problems. Just come here. A group of practitioners from different disciplines will try and help. And that is a uniqueness. And this shared platform of interprofessional education program, so that the professionals who are members of the IOIHP or integrated organization of the international organization of international health practitioners will learn about each discipline so that they don't hate, they support other disciplines as and when necessary. And that is in the interest of the patient care, to provide the best care of the profession and best care for the patients. And we would have some policies that would encourage the integration of these practices. So I think that is amazing. I think we have got Professor Rajan Patankar as well here. So I don't know if you want to help, and Anupul Goswami, who is in India as well. He's traveling, but yeah, if you throw some light, and then we'll move on and get some more views. Rajanji, you and I have talked multiple times, including today, and you firmly believe you have been doing some part or some aspects of it, both the nanotechnology into Ayurveda, and you believe that these should work together. And so would be good to hear your views. What would you like to say?
Yes, as you said, we have talked so many times, and integration is nowadays need of the patient, not need of the hour, I should say, because each and every doctor or each and every professional should understand the strength and weakness of each science. That is, in my opinion, most important, because every science is not a complete science. So if we come together, definitely it will help the patients or help the to maintain their health. Because Ayurveda says prevention is better than cure. Swastha se swastha rakshanam is the tagline of Ayurveda. So that's why, in my opinion, we should and we must integrate to give a good integration support to all the patients all over the world, I should say. Because if we get together, as Rajuji said, acupuncture, definitely there are strong points there also. Then the Chinese system of medicine, there are also strong points. So if we come together, it will definitely help a lot. I work with one of the famous cardiologists, Dr. Ram Murthy, for 6 months. After, when I said to him, I want to start my own practice, he says, yes, but keep in mind two things. Your science, that is Ayurveda, is a complete science, but in my opinion, should be evidence-based. Our science is on trial and error. So that's why yours is complete science, and you have to or you must practice Ayurveda only. And second tagline was expert doctor or expert Vaidya must follow this rule. Minimum medicine is maximum results. Because nowadays in our college also or any of the young practitioners, they prescribe minimum 5 to 6 medicines. And in my opinion, that is not correct. To integrate, we should follow that also. Minimum medicine is maximum results. And for that, specific diagnosis is most important. And with allopathy, we can do that. So integration is must. And as Rajuji said, I am manufacturing nanomedicines for last 17 years. And patients are benefited because so many of our Ayurvedic gold preparations or metal preparations, which are, there is a question mark all over the world, but not I am as a Ayurvedic physician. There is no question mark because if they are purified, no side effects, 1000%, and doing that to the nanomedicines definitely helps patient because it is cost effective, fast acting, and definitely we will work together. So thank you, Rajiv for giving me this platform. Thank you.
It's amazing, amazing. It's so good that we have this spectrum of people who believe, and now more and more what we heard from Rajanji, that it's there and it just need time is right now to roll it out. And it will be good to really have a lot of people joining and in form of a community of people who believe in this philosophy and speak to their friends, families, as many, without any hesitation, without any prejudication, without any judgment, without any fear that this is the future of the healthcare. Because if we don't do that, there are plenty of challenges, and that include the pharmaceutical industries. I'm afraid to say that, and then with no offense, that is just a way it is. And there is a lot more one way, because the evidence and a lot of investment happen the way the allopathy works or the modern medicine work or the Western medicine work. And that's why all that investment needs to be recovered. And in this revolving world where money is one of the important factor that happens. But as Dr. Rajan Patankar said, that money is not the only driving factor. Money is not the driving factor. In fact, our conscience, our heart, our ability, our contribution, our ability to reach to the center of patient-supported care, it should be the driver. And I'm glad that that community is now formed, and I'm glad that right from that, across the generation, we got like Abhista. He is one of the very young person, but he think it's a noble cause. It must happen, and their generation and their future generation will immensely benefit from this type of noble cause. And so, Abhista, do you want to talk about how this community is going to work and what's kind of your thinking on it, how we can make this more widely publicized and how we can make it happen in real life? So thank you. Let's hear.
Thank you, Dr. Rajanji. It was nice hearing you. Please stay around. Thank you so much. Yes, Dr. Rajiv Gupta, who have we lined up next? And it's a good integration of people where we are talking and discussing a lot on the facets of different parts of understanding how integration of health and the perspectives in different domains are important. And it's time to invite our next guest. Over to you. Thank you.
Abhista Vishwamitra, commonly as Vish, is one of the young generation, and I think
Double namaste.
bubbling with the enthusiasm on putting his energy into bringing this. And I'm glad that there is across the spectrum. Look, Rajanji on one side, Amrita, and there are many other people, and right from to Abhishta, he is or Vish commonly called, he is quite a young person from Leeds University, and he is joined here now. He's putting his time, energy, and force into making this integrated medicine work, and the whole the concept, what was a dream of mine many years ago, the international organization of integrated health practitioner, into reality, creating community, creating a membership platform, creating the resources for people, creating how people would benefit, how patients will benefit, how the practitioners will benefit, and how the whole ecosystem is going to immensely change the landscape of the healthcare. Over to Avista.
I hope I'm audible to everyone.
Yep.
Yes, very well.
Fantastic. Namaste to everyone. And firstly,
Namaste.
thank you. Firstly, I thank the organizers for giving me this opportunity, and I thank Dr. Rajiv Gupta for inviting me here. So quickly introducing, Dr. Rajiv has already given a lot of information. So I'm a business consultant, and yes, you can all call me Vish. So I would like to tell the story of how I got connected with IOIHP. It was a random day, and I was at this event called India Day celebrations here in Leeds, UK, and Dr. Rajiv also happened to be there. So we just bumped into each other, and casually we were exchanging synergies. And then Dr. Rajiv immediately said about his work, and he also sort of put across the philosophy of integrated medicine. He also shared his book with me, and that's when I realized that, well, this has to be a thing, isn't it? Because I'm in my early 20s, fortunately, unfortunately, and then I could resonate with the concept and the philosophy because I had my grandmother who was suffering from arthritis herself, and she could not find a solution for almost 2-3 years from the allopathic medicine. So that's when a lot of other complementary medicine and alternative medicine had to be brought into the mix, so that she felt better down the lane because all of those things were integrated. So somewhere, although I had my experience in it, I never saw this as a philosophy because I'm from a non-medical background. I'm completely no way related to medicine or the doctor fraternity. However, uh, I immediately connected with this philosophy of taking this patient-centric, holistic, integrated medical care, and just providing it to the common mass out there. Uh, Initially, Dr. Rajiv also explained a lot more about his research, how he has been spending his almost last couple of decades dedicating his time towards building the philosophy in itself. And then, of course, we had a great conversation, and we came up with this idea of having international organization of integrated health practitioners. Dr. Rajiv had already set that up, and then we discussed that it's the right time and it's the golden opportunity now, since kudos to all the other speakers also who are trying to share this philosophy with us. So we thought this was the right opportunity to sort of build a community who share this philosophy, so that down the lane it would sort of enable us to take that holistic and integrated medicine and give the necessary patient care, which is the patient-centric care. And also thanks to all the ambassadors who have shown their interest with us and the philosophy, and who are trying to help us to spread the word. And along with this, there are a lot of plans and vision and mission that we have for the organization. So Dr. Rajiv has already shared quite some information on that. And the very initial step that we have recognized is to build that community, because often, as Dr. was also saying, often all these variety of branches work in silos. So there is no integration in between the variety of branches, although each one of them have their own benefits. So the whole noble idea or the cause of integrating all of this is very exciting to me, from an external point of view and being a non-medical background person. So with that note, I urge all the members who are here to, definitely reach out to us if you have any questions, become a part of the community and support the philosophy, so that we have lots of things planned up, as doctor was saying. We want to sort of raise the awareness inside the community first, allow a lot of health practitioners and medical practitioners to learn about other forms of alternative and complementary medicine and therapies. We want to have all sorts of networking and summits where the whole philosophy is discussed. So we have lots of exciting things planned up. So it would be worth for you to sort of sign up and show your register and join the community so that you can hear back from us. Thank you.
So I think Nishit is
Thank you. Yes. Yes.
so yeah, I think that's great that we have that how people can join this movement. In fact, that is a great slide so that I call him Abhi. Vish and Abhi are like Abhi is his like first part of his first name. Vish is the first part of his second name. Vishwamitra Vish, Abhishta Abhi. So I call him Abhi, but many people, or a lot of people, call him Vish. He has done a lot of work now. And this whole community of joining, he is determined, as you heard, is a young, enthusiastic person to make it happen. And I would urge all people who are on call across the Facebook, the YouTube Live, the Periscope, and other streaming platform, as well as those who are on the Zoom call, that please just scan it from your mobile phone and join this. And Abhi is actually committed to communicate back to you, to take you to the next step and help you, because it could be a general public, it could be a practitioner, it could be anybody who believe that this is the future. This is how the patient care should be delivered, not in silo, like a train track. It should be a combined approach. It should be a holistic approach so that the patient get the best care, irrespective whether it is a Western or modern medicine or alternative and complementary medicine or allopathic system, anything. All of these have a role to play, and that should be the future. So please join the community. So that's great. I don't know if Dr. Bhushan
Marvelous.
something more to say. Thanks, Amrita.
Yeah, that's really remarkable, Abhishta. In fact, a lot of things are required on these platforms, and people like you who are young bloods and young brains to put their head into and bring out something new for the world to heal is very important. As and by the world and the younger generation is facing a lot of mental health issues, the suicidal rate is pretty high. People are prone with and are in fact born with anxiety and depression and stress and all these things. It's very horrific to hear and see people and children, especially youngsters, who still know the words where we were used to play in the grounds. These children know what is stress, what is anxiety, and it's very pitiful. And then for the word to come out of it and the generation to look into a more brighter aspect of life, it's very important for each one of us to integrate and bring these facets out in the schools and various other institutions and in those community lobbies where children are involved, so that these younger generation come to realize and know how important and what all things are. And moreover on that, I would stress, because being a practitioner, I realize when patients come to us or when we go to a doctor, it's pretty late. Unless we don't have pain, we don't take an effort to go to the doctor. It's just some education or some vision and the Google doctor that tells us, otherwise people don't go. But sometimes it becomes very late. If we train this generation to know about these things, their lifestyle can be a very grooming side on themselves, where the prevention of the disease can be at a very large level. And this will not only reduce the diseases, but also the health burden that the country holds in various parts of the world, which will be a great initiative if it is taken forward. So all the best from all the team of Healing Our Earth to you. We'll be connected, and I have already taken up your QR code and have joined the community. Thank you so much. Please stay around. around. Dr. Rajiv, I think Rajan sir has some comment. We take the comment and then we move to our next guest.
Fantastic. Yeah.
In the minute.
It's good to see
Rajanji, kindly unmute yourself and over a minute, kindly
Yes.
your comments, please.
Yes, it's only one
Thank you.
comment. A very great initiative by Abhi, as I can also say him Abhi. So, in my opinion, we should percolate these things in the community as per their lifestyle or as per their climatic conditions of the country, because Ayurveda doesn't fit to everyone everywhere. So that's why we have to do some model for that also. That is my opinion. As per the climatic conditions, as per the Prakruti, that is the body constitution, as per their food habits, that ahar vihar should be taken care of. So to communicate with people and to educate them should be our first priority, because if we do that as per Ayurvedic concepts, that is Rutucharya and Dinacharya, that is regime, climatic or our personal regime, it will definitely help to avoid any kind of diseases to anyone. So that's my opinion. Thank you.
That's fantastic. I don't know if Dr. Bhushan Patwa then has sorted his camera.
He just left, I think, or he's there. Yes. Dr. Bhushan Ji, if you're there, you can please join in. By the time, Dr. Rajiv, it's time to take our next guest.
Yes.
Over to you. Thank you.
Lovely. So that's amazing. I mean, it's so good to hear the whole spectrum of conversation, people's thinking, commitment, and ability to put their energy.
Dr. Bhushan
thank
Ji
you.
is here.
Please join, Dr. Bhushan.
Thank you. I'm listening to all the exciting conversations, and the one thing I wanted to add that the World Health Organization now has a global center for traditional medicine established in India, and their mandate is also to promote scientifically all these activities. And Dr. Rajiv, we have given a call for papers. There is going to be a special issue on traditional medicine coming up in November 2025 by the WHO Bulletin. And we are requesting global experts actually to contribute for this cause. The effort which all of you are doing is extremely important, I feel, because today, as Dr. Patankar, I think, said that people need it, whether regulation or all those things are apart, but people need it. And we must come forward to deliver in the best interest of the people, So the patient-centric approach, what you have seen or what you have been promoting, and what examples actually you have narrated in your own book, these are based on your own experiences. And in India, I must tell you that during COVID-19 time, we have implemented this integrated approach very, very successfully. If you go to PubMed, you will find at least 60 papers in good journals which have come across which show that these integrative interventions have helped COVID-19 prophylaxis and mild to moderate treatment also. And for example, in our double-blind clinical trial, we showed that hydroxychloroquine was inferior to ashwagandha. So we have so much of evidence and so much of data telling us that if we go together in integrative fashion, in scientific manner, there are definitely advantages. And this group actually, I think, is very well equipped to do that. Amrita ji is steering it so well that the articulation which she is presenting, this is what is needed. The kind of language, Dr. Gupta, you are speaking, is needed to convince others to come into this. So thank you very much for making me part of this. I'm going to be here in the group for another 10 minutes or so, and then I will sign off silently. Okay. Thank you very much.
Amazing.
Thank you very much. Thank you for your opinion as well as guidance. We look forward for your support, and please stay around as long as you can. Dr. Rajiv Gupta, it's time to take our next guest, and over to you.
Amazing. So I'm just thinking that
Thank you.
we got Dr. Khan. He is the other like a medical practitioner, and he has brought into this all mix of the allopathic or modern medicine along with the Ayurveda and other alternative medicines in real life. He's practicing in Bradford and he is actually doing. So while we are a platform, are proposing, and I have done the work for nearly 10, 12 years, but I myself stretched too far to actually do the real life implementation in every place across the world. But within the UK, here is an example where he has brought into the real practice. So it will be good to hear his experience, particular diabetes. And his motto is not controlling diabetes, reversing diabetes. And if we have, and although I have taken the examples of many of these things, the scientific principles, and I have done through the yoga, and I'm myself a yoga trainer, yoga teacher. I have done the qualification in Ayurveda. I've done even a diploma in homeopathy through somebody called Mamalil Homeo Mission, and that was like 20 years
Yeah.
ago when I was
That's wonderful. Yeah, Dr. Rajiv, that's wonderful. Let's welcome Dr. Abdul. Global namaste to you, Dr. Abdul. A very good afternoon.
Namaste, everyone. Namaste. How are you, everyone? Thank you, Rajiv Bhai, for the introduction. And it's a small efforts which we, as a team, we have a team of doctors, as I said, as you have clearly mentioned it. I'm trying to bring different healthcare sciences on a single platform and bringing that and in search of basically cures. Basically, if you see the modern conventional medicines, we have lost the touch of basically what the meaning of actual cure is, So we are trying to search the cure. So I'm starting something called Uncoding the Cure, the small booklets at the same time, where we're trying to understand what science brings what, So our vision is, if you see the bigger vision of our platform, is to basically to search cures and to implement the same thing and convey the same message to the doctor at the same time, bringing them to our fold and at the same time asking them to go for a commitment of cure, basically, right? So that which is lacking there, you see that. So if you come back to diabetes now, which is one of my favorite subjects, which I'm already helping a lot of people to come off medications. It's very interesting to know, like most of the specialists and super specialists, which I'm talking to doctors, especially diabetologists across the world, and they have been kept, to be very frank, they're just following the pharmaceutical version of cure, I can say, which is not the cure, which is just a management. So it doesn't make sense to them to create a cure pill, isn't it? They want a management pill where they want to sell it again and again. So that's the problem there. And unfortunately, whole medical sector has been hijacked, I can say, by the pharmaceutical version of cure. And so that's what we have to stand now together and understand. First of all, we need to understand that we should not defend the lies, enough of the lies, what we doctors have been practicing. And at what cost? At the cost of human life. No, that's bad, right? We are just focusing on the symptoms. Why? Why we are focusing only on the symptoms? Why we need to follow only one conventional method which is a flaw, which is a big flaw there, right? And the reasons we all know it very well, right? So the vision right now for us is to unite together, definitely. And Rajiv Bhai has taken great efforts there. He's trying to bring all this platform together. And this should be the approach for the forthcoming and for the future. And I think I was just discussing with Rajiv the other day, we should create something called an institute or some kind of a university on the basis of this philosophy, where the approach has to be commitment to the cure, which is lacking basically. And if we ask doctors, right, why you are not targeting the root cause, why just the symptoms? Because they think symptomatic cure is what they're looking for basically, and they've been trained to just look for that. And the major drawback, what I feel, is we doctors, medical doctors, are not being trained about the diet, right? When I started learning about diet, When I started learning about food, I was literally shocked. Oh my goodness, what is happening? We have been kept, we have been kept away from all these realities and facts. And so I started bringing different sciences onto a single platform. And then I realized it's a very great opportunity for us to help a lot of people there out there. And at the same time, if you see the burden on NHS, right? This burden can be relieved if we just bring all these alternative solutions to, on a single platform, and we offer them some kind of this kind of offerings to them, right? So I have some cases which I like to share with you, very interesting cases. I have some cases where autoimmune disorders, we have helped autoimmune disorders as well, just with diet, just eliminating few things. So we are basically focusing on two programs. If you see, one is diabetic reversal program and an immune repair program. Diabetes reversal program is what we are doing in the diabetic reversal program is we are focusing on the root cause. If you see that metabolic components, that's very important, that we need to understand that we need to see the diabetes under the perspective of metabolic syndrome, not per se as alone, right? If we see under the umbrella of metabolic syndrome, the solution is there for us, right? And solution is there for us, and our patients will get 100% relief. This is what patients think us to a different level. They think for Indians, for example, in India, they think us as a god, right? So we need to at least act like that, at least give something which is valuable to them, give them a route where they can find a holistic journey. And holistic journey cannot be approached, cannot be achieved with just only single approach. It has to be an integrated approach always. So this is what I realize now, because integrated approach is the future, and it has to work. We need to work together. We need to work. I think we should join hands together, and strongly we should raise this voice. Like stop defending the lies. Enough of the lies at the cost of human life, right? So the thing is, type 2 diabetes, which is 80%, 85% of the patients I have seen who have come on my platform, we have helped them come off the medication in just 2 to 3 fortnights. That's it. Just within couple of weeks, we can bring up them off the medications, and they were hooked to medication for almost 20 years. Right? I have some patients who have now NHS patients. I have with NHS patients also. I help NHS patients as well to come off the medications, and they stopped taking medication. They were even put on insulin. How can insulin be given? That's a big question. How can the insulin be even thought to be given in type 2 diabetes when the problem is hyperinsulinemia? But the problem is, this is the problem there. So we need to understand this. The whole approach has to be corrected there. So there's a big lacunas, there are big issues there, Dr. Saab. So
I think one has to be careful. We should not criticize anyone.
Yeah.
It's just people are doing what they are doing at their best, but it may not be best for the patient. So if we
Yes.
can look from the patient point of view, we should expand the view and add bits and bobs, and maybe at times navigate or direct, so that patient is the focus, patient get the best benefit.
That's what.
Perfect. So that's great. You are doing a fantastic job. Yeah.
So we have so much of patients. I'm telling my super specialists, I'm telling them to, okay, fine, you follow your symptomatic approach. Fine, it's okay. But you send us any complicated cases we feel the patient needs some help. So we have some patients, Dr. Saab, where we are helping them. For example, we have some patient of very severe for 20 years. She was a methotrexate, right? And she was in Celsep. And we have even helped her to come off those medications. It's mind-blowing, actually, to be very frank, because we just told her to just diet. We just told her to remove the triggering factors from her diet. The GMOs, which is a big issues, right, currently. The big issue currently is the GMO. Like, that is one of the, I think, all these autoimmune disorders, what we are seeing, like graph, like rising like this, diabetic and autoimmune disorders, all because of this wrong guidelines, one wrong guidelines, which we have been given by the diabetic associations of US American Association, given wrong guidelines to us till 2016. They said they were anti-natural fats, basically. They said avocados is not good. They said they were saying, like, that, and the carbs, they told us carbs you should have 60%, 50 to 60% of the carbs is okay. So if you see this whole dynamics have changed because of the wrong guidelines, and the whole world has seen the whole rise of diabetic epidemic. You can say we are living in an epidemic currently, and just because of the wrong guidelines now at 2016 they have corrected a little bit there, but in 2016 till 2016 it was they were anti this good natural fats. because without any scientific evidence, they just said, and there's a lot of reasons are behind that, definitely. And as Dr. Rajiv Saab suggesting me not to criticize it, but I could have taken the whole journey of criticism, actually, to be very frank. And the people who are sitting on these guidelines, who are deciding what to eat to the human people, to us, general people, they are having influence with the pharmaceutical industries, right? So I don't want to discuss more on that now. So back to our discussion. So we help a lot of patients, doctors have. We help a lot of patients to come off these medications. Also, like type 2 diabetes coming off medication, and we help a lot of patients, especially Hashimoto thyroiditis, like celiac disease,
So what do you
SLEs.
use for, say, for example, diabetes? Because I think if we focus on diabetes, and Hashimoto and anxiety, say, for example, these three conditions. So tell us, what do you use for diabetes in your
Yeah.
practice, and how do you reverse? So
Yes.
that
Yes.
people understand and they can try.
Yes.
Because one of the
Yes.
other aim I have is
Yes.
replicability.
Yes.
Because
Yes.
if people
Yeah.
can
Fantastic, sir. I'm going to tell you. So, for
deliver.
example, if it's a pre-diabetes, you must have heard a lot of people, all doctors are here, most of them doctors. So we all know like pre-diabetes can be reversed, right? So it's possible, right? So what, on the basis of what? So all doctors suggest, okay, for pre-diabetes, now it's a new guidelines. They say like, low carbs diet. Okay, low carb diet is a very good option to start with. Exercise, sleep, stress, all these things has to be managed. That's very important, because everything comes under, because metabolic disorder, the issue which come metabolic disorder, all this related, everything which is, all these things which I just mentioned has to be taken into consideration, just not the symptomatic cure. That's what I'm trying to say. So when we do that, so what we do is, first we do the assessments for the person who wants to treatment from us. So we'll do the assessment. After the assessment, we do MDT meeting, right? We bring everyone together, all our teams. So I have a team of Ayurveda specialists. Then I have homeopathic doctors with me. Then we have a doctor from functional medicine side. We all come together, we discuss. Now we have the own protocols are all ready now. We have protocols for diabetes is ready. But if you have diabetes with associated comorbidities, we bring everybody together and we give a systematic approach. And most of everything what we offer through our approach is the diet. The diet we focus is the low carb and high fat diet. Why we focus very low carb and high fat diet? High fat means very good quality of fat. I'm not trying to push saturated fats there. Only unsaturated natural fats is what we are promoting them. And that fat helps in the satiety. And low carbs, basically our target is to bring the people and on our platform, and we have to see that the insulin resistance has to be reversed. So how we reverse the insulin resistance? There are 2-3 approaches are there. One is low carb, high fat diet, number one. The second is intermittent fasting, right? Intermittent fasting, which is a very vital thing. We have got amazing results with intermittent fasting. And that's one thing. And then, of course, we have added yoga to them. Okay, yoga to them. And on the basis, now I'm going to start now something which I was discussing with my team. Since last week, we're having a lot of internal discussions. We want to bring this analysis of Vata, Pitta, and Kapha also once we start giving them the diet and food to them. So this is what we are trying to do from the coming weeks now, very soon. So we are starting to do, then again, we are trying to do a reassessment. So we're working on the reassessment of the whole thing, how we want to reassess that. And the thing is, we're getting wonderful results. When I'm thinking, when we bring this integrated approach, already we're using yoga for our patients. When we bring this assessment part also in that thing, fantastic. I think nobody can beat us. That's what, because the thing is, integration is the key there. So we are integrating it there. So that's the key there. So we help so many people to reduce the HbA1cs and the blood sugar. And first of all, it need a guided approach. Pre-diabetes, we're giving them the do-it-yourself document, DIY document. They just go there on the website, download the document, what they're supposed to do, how they're supposed to eat, what time they're supposed to eat, and what they're supposed to avoid, and all that. Everything is there for them to just follow it. But for people who are medication, they need a guided support, right? This is what all the clinical trials have mentioned. So they need the guided approach. So we give them the guided approach. We put them, first of all, we create a group for them in a WhatsApp group. So in that WhatsApp group, we have a doctor, we have a dietitian, right? In that group, then we have yoga expert there. And my yoga experts are not just yoga. My yoga experts are doctors there. Ayurveda doctors who are giving the yoga, who learn the yoga, what exactly yoga is in the universities, not on the YouTubes, right? So we bring all this together. And then that's what we're doing is we give approach, then we give them the meal plans on a weekly basis, meal plans, right? And we suppose weight is the problem there. So we keep a track of the weight every week. And depending on the week, depending upon the response, we change and alter the diet plans. So weekly meal plans is what we give them. And meal plans are basically low carb and good quality of fats. Okay, because the reason for that is Why are we giving this low carb and high quality? Is because low carbs will not trigger the insulin release in the body, right? So we need to see that when keep that, and we have something, and another interesting thing, there's a lot of people are not be interested for intermittent fasting. We have something called fasting mimicking diets. Fasting mimicking diets. And these fasting mimicking diets is a very low carb and good quality of little bit of fat is there. That does not trigger the insulin release. So once you start taking, so usually we put everyone, because they signed the CM, they're on PubMed now. There's a lot of research done, a lot of clinical trials are done on FMDs now. It says like any person who's doing this FMD 5 days in a month, they can avoid lot of metabolic related diseases. They can avoid even cancers also. It has wonderful results in reversing your metabolic issues. So we put everyone who coming on a platform, for 5 days, we give them a FMD diet, that's fasting mimicking diet. So in that diet, we see that the insulin is, our diets and every approach, we focus on the hormonal level. We don't focus on the symptomatic level. Hormonal. So what insulin is doing, when we give something, what insulin, when somebody is fasting, how much glucagon has released as a compensatory mechanism, what noradrenaline is doing there, what adrenaline is doing there. So my team is not focusing on the simple calorie counting. We focus only on the hormonal level. So when we discuss the results, we'll talk about the weight loss, we talk about the approach on like doing some peptide tests, like fructosamine test, and all those tests, like, which are like to understand like a HOMA test. And also we do all this testing to keep a track also, like where they stand and how they're approaching and where they're going towards. So on basis of that, we alterate and we support them. And this is what we are actually giving them. And we give them 24/7. Even we help them in pantry support. The problem is even doctors doesn't understand that. To very frank, as a medical doctor, I was away from from the diet and meal plans, and so I was not at all. To very frank, I was not that expert. A little bit of knowledge was there to me, but when I started doing more understanding, research, knowledge, and all, I realized food itself is an amazing miracle thing. Where if you just put the food, because food when you're eating, it is not just eating the food. You're sending the information inside you. That food, what that food gonna go and act, and how it's gonna act. So that's what our approach is. Our approach is to club evidence-based functional medicine and integrated holistic health approach, bringing yoga, Ayurveda, and this assessment which I'm saying now, and to give a complete journey, a very fruitful journey where they enjoy. They'll feel it energetic when they come to a program. They feel it. They were not active. Somebody said, I never used to go to kitchen. I started going to kitchen now. And when the husband says, we have different feedback which I'm getting. My husband says, like, oh my goodness, I couldn't change my wife for almost 15 years. Within just 15 days, I could see the fridges without any bars. The other thing what we are happening is, this, because of allopathy medication, conventional medication like metformin, all these things, people are getting, we are spoiling their habits because of that. We think they're developing a new habit, saying like, fine, we have to take the tablet now, let's have some sugar, let's have some sweet, let's have this thing, let's have that. Because any which they're going to take the sugar. But the problem is that every time they're having something carbs, okay, the insulin is getting released, and that's the problem. So we need to understand that, doctors need to understand, we need to all actually, I feel that type 2 diabetes has to be taken under the consider metabolic syndrome, and we need to see the components of metabolic syndrome, what exact components the person is suffering. So for example, more the components of metabolic syndrome, we all know what are the components of metabolic syndrome. High triglycerides, like LDL, bad cholesterol, high in LDL, right? And obesity, that's another one thing. Insulin, this is part of metabolic syndrome, hypertension, metabolic syndrome. So we need to understand, we need to bring that together. That's only, I think, the approach will go from the symptomatic cure to the approach we're focusing on the root causes. So I feel integrated medicine has to be a future. Why? Because that will bring the reversal, the opportunity to reverse the diseases, that will bring the opportunity to work on the root cause of the disease rather than the symptomatic cure.
Wonderful. That's great. Thank you so much. It
Thank you,
is
sir.
so good to see, and it's interesting to kind of have the scientific basis, because there are a lot of people who claim,
Yes.
oh, I have cured this, I've cured diabetes, I've cured asthma, I've cured this. But how? What did you do? And why did it help? Because unless in the generation that we live now, we need to know what works and how. Even for people who go and buy the stuff, you go on Amazon, if there is no review, you would be very skeptic buying that product. And the same thing is true in medicine as well, that if you don't have any scientific basis, any evidence, or any surety of it's going to work, who is going to take risk for their own body? Because you got one body in this life.
Definitely.
Depending on you believe in rebirth or not, that's a secondary matter. But even in this life, you've got one body. You wouldn't want to put the things through into your body which you do not believe is going to be helpful. And hence, it's so good that if we combine the things and bring selectively what we know is going to work and why, we can, it's like ice cream, isn't it? You can have a choice of flavors, and the same flavor you may not like again. And same is for the same disease at some other point in time, the same medicine may not work. And therefore it may need different. And instead of people going and shopping different practitioners of different disciplines, it'll be good that all can be given in one roof.
Yeah.
And then patient gets the benefit. And that's the patient-centric care, which we have been talking about. So amazing. Thank you so much.
Thank you for the opportunity, sir. Thank you for the opportunity, Rajiv bhai. Thank you everyone for listening. If anybody have questions, I'm ready to answer.
Yes. So if you have any questions or comments from people, because we have got a lot of people who are ambassadors. We have got Elaine, please. Elaine is one of person from our Silver Tree Health Network, where I've been part of this for nearly 4 or 5 years. And she is also one of the persons, she delivers health, and you will hear in a little bit more detail, but here's a question or comment. Elaine, go for it.
Dr. Rajiv, before we go ahead, I have a special message I was asked to share. So, oops. I have a special message to wish Elaine a very happy birthday.
Oh, wonderful.
Oh.
Happy birthday.
Elaine has
Happy birthday. Happy birthday, Elaine. Kindly unmute yourself. Okay.
Let's try and do
Please give us a moment. By that time, we can have a lovely birthday song for you. Happy birthday to you.
She's saying it's not her birthday.
It's not her not your birthday.
Elaine, you can click on unmute.
Okay, right. I've unmuted now. Thank you. I couldn't unmute. It gave me a message.
No
saying
problem.
Unmute. But thank you very much for that sweet message. Thank you. Now I can't bear singing. Singing for a birthday spoils it in my view. But thank you for the sentiment. I just wanted to say how refreshing it is to hear doctors talking common sense at last. Absolutely at last. I'm going to be talking at 3:45, I think my slot is, and I'll be responding to a lot of this. The integrative method is the only way. There's taking the best of the national health for acute treatment. Yes, absolutely. Let's not bash the doctors or the health system, because when you're in an accident or something like that, we really need the medications and the support. But on a day-to-day basis and for prevention, for goodness sake, people, just wake up. The world, wake up, please. Come on. We've had all these wonderful Ayurvedic and yoga and meditation and all the rest of it for thousands and thousands of years. We've only had the Western medicine for the last, 150 years? And suddenly it's taken over, and it's just wrong, absolutely wrong. So it's really refreshing hearing you guys talk common sense. So thank you. And I'll enlighten a bit more about what I've done, because I'm going to be speaking from a different perspective later on. Thank you.
Amazing. It's so good to hear.
I would just like to add something, Rajiv bhai, there. Sorry if you give me permission. So it's all started, Elaine, it's all started with my own journey. Okay. In 2021, I got a severe heart attack, and I was lucky enough. I was picked up by Elaine and Clarissa. I was in London East that time. They took me to the hospital. It was all an emergency. It was they just saw me on the road. I was so lucky some nurses saw me and they picked me up from the road. They took me to the hospital, and emergency services, kudos. Without that, my life could not be saved. Right. But after that, they put me on 9 medications. That's when I started doing research. One of my sister from US, she was doing research on food. She said, "Bhaiya, add this one." Then my mom suggested me something, so I added something to that. Then I started doing research, how it is affecting, why I'm feeling so amazing and energetic. Today I do Surya Namaskars every day, almost 100 Surya Namaskar. I do push-ups every day. I don't take even a single pill of medication. So I'm saying so much of NHS.
Brilliant.
I myself been an example there.
Brilliant. Well,
I
I'm
save so
also,
much of NHS
yeah,
every sorry.
I'm also an example. I'm 10 years this year. I'm 10 years stage 4 cancer free. They told me I'd be dead by Christmas in July 2015 unless I followed the medical model, and I didn't. I followed my integrative version, which I'll tell you a little bit about later.
Congratulations. Yep.
Amazing.
Fantastic. Congratulations. See, this is what we when I could reverse metabolic issues, because my heart attack was because of a metabolic disorder. If I understand that. So if I just reverse that, that's because I could do that naturally, because I just got some Mediterranean food in my daily routine. I did some adding some ajwa dates, like integrated holistic things from here and there, Ayurveda, few things from Ayurveda. That's enough for me, because and there's no side effects. The first thing, there's no side effect with those medications like beta blockers and all that thing. I was feeling sweaty palms, sweaty feet. I was not to the maximum strength. I was feeling that unless with natural route, I could able to recover myself almost better than before. I think now better than before. Yeah.
It's
Yeah.
so, it just proves the point that if you use it judicially and carefully and do not misuse or misjudge, go to the right therapy at the right time,
Correct.
then you can make wonders, improve your life, improve life of others. If you do not misuse, then it is a boon. If you misuse, then it's a risk. So it always comes with health warning. And I always say to all the members of my organization that, look, everything has got double-edged sword. As you mentioned, if you would not retrieve to go to hospital when you have a heart attack,
yeah,
you would not be talking to us today.
Definitely.
The mere
Thanks to modern medicine.
Sorry?
Thanks to modern medicine for that.
Exactly. So everything has a place.
Yes.
So we selectively use everything at the right time. And it's so good that with this platform that we have created, we will be having complex cases discussion. So people who have complex cases, at times GPs come to me that, I've been trying and nothing is working. So for complex cases, bring the cases to here. We will have that platform. We will have practitioners of all varieties there. They can have a discussion and then they can give the advice, and it's up to the practitioner. They can take back, advise the patient to use what is going to work. And that way that people are not stuck and patient get the benefit and the practitioner get benefit. It's good for all, because that is what truly holistic care is.
Definitely, sir.
If we are being very paternalistic, if we are being selfish, we will do only what we know or what we are trained in, either modern medicine or Ayurveda or acupuncture or various variety of things. But there is a world beyond that medicine discipline. There is a world beyond. Let's be open-minded, look at it, accept what is useful, and if it doesn't work, it doesn't work. There is no guarantee. But a combination is very good in some way, unless there is an evidence to the contrary or there is a risk. And we should be very vocal, clearly explaining that you go to your competent health practitioner, take the advice. This is what we are suggesting. It may work, but we have to have that assurance that we are not taking responsibility for your individual health care, because we are not responsible for your health. Your health is your property, it's your responsibility. You can get the advice from a qualified medical practitioner. It could be allopathy, it could be Ayurveda, it could be any discipline, but go to somebody who knows what they're doing. Discuss your problem, and in theory, you should be the center of care. You should be in final decision-making capacity. And I know currently we are having a lot of challenges because of certain disciplines are not authorized, particularly in a world like UK, where the healthcare is free. But if we work together in form of the community that Vista has talked about, then we should be able to design and put a pressure through the patient support group, and a lot of patient support group are with us now. National Forum for Health and Wellbeing, which is a charity now more than 20 years old, and Professor Romesh Gupta, who is the chair, unfortunately is not here today. We have worked together on it for a period of time, and there is more than enough support from the patients themselves that they like cure. Reiki, the energy therapy, there may be not evidence from the medical point of view, but there's enough evidence from the patient point of view. And there are many other things which work. And you all know that when you listen to nice music, when you're stressed or have anxiety, you can actually have relief. So you don't need evidence for it. So it's like one of those things which is a bugbear. We have support from like some universities as well, but we are going to have some formal arrangements in order to protect. And I think there is a movement forward. This 2025 is going to change the world and landscape of medicine, making it more holistic, more approachable, more patient-centric, and more appropriate for future. So unless you have a question, Elaine, I was thinking Anukul might have something to say, or we can then jump on to you to bring, or I'm sorry, Manisha is before you, Elaine, unless you are in a hurry. So Anukul
Yes,
is,
Dr. Rajiv.
yeah.
Yes, let's take up some comments from Dr. Anukul.
Yeah, so he is a medical practitioner, he's an orthopedician, a spinal surgeon in Manchester, Wigan. And we had on multiple occasions, long conversation for an hour or so, just on this topic, because both of us are the allopathic or modern medicine practitioner and have been practitioner for decades. But then we also have opened our mind to other form of health practices, disciplines, alternative complementary medicine. And he has example in his own family as well, that these things work. And the question is how we popularize it, how we make it visible to people. And Integrated Health Practitioners Forum is the platform. The whole organization is set up with that goal in mind. And we are all now having more and more inquiries, more and more people interested in it, and more people keen to support. So please do go to that page, which Nishit Kotak has kindly shown before, so that you can go onto that page, at the healthpractitioners.com, IOIHP community, join the community. If you're a practitioner, ask for it, send an email, send inquiry, and he is going to get you the best possible way of you contributing. People are now taking deals on encouraging the CPD, the continuous professional development part of it. They are going to take lead on research part so that we can show to the world some evidence for it. There are videos, there are other programs, there is community support, there is a support, not only just in terms of the medical science, but also how the other sciences can uplift and bridge the gap between the two. So I think that is fantastic. So
Yeah.
please share your views,
Yes.
Anukulji.
Yes.
Thank you very
Global
much.
Namaste to you, Dr. Anukul.
It's amazing hearing. My mind has gone all over the place, and I hope I can get my mind concentrated and focused to give some coherent answers. There are a few nodal points, and then I will try to see how I can link them and come up with some subtle and very important questions which are vital for our future. I don't know. First of all, the concept of silos. I must thank to bring on this particular issue of silos. That was my major dissertation and thesis work for my master's in law program, and in that really helped me. And I brought to the fore the fact that breaking up of specialties is not a very good idea, because we have it in orthopedics. As an orthopedic surgeon, as of now, there are 43 subspecialties. That includes, now we are going to be having a little toe subspecialty as well. So I'm just joking, but the reality is people do not talk to each other. And the result is patients with a no, I don't like to use the word patient. There are people who will go around from place to place, surgeon to surgeon, waiting for 6 months, 9 months to get an appointment, being told, no, it is nothing to do with your hip, it's something to do with somewhere else. You'll have to see, go to meet somebody else to find out. And that is very sad that we are not, the very idea that we think we know it all is a myth. And it did not take me long to realize that despite having studied and got medals or whatever it is, you soon realize that it doesn't work that way. It doesn't work by just reading some books or seeing some patients and coming to answers. You have to go to various people to understand it. And I understood it first when I was in the army in the Himalayas. And our nearest place to evacuate the patient used to take normally about 7 or 8 days if it was on stretcher or on vehicles, or it was very hard. So I used to be across a particular borderline with the Chinese, and we used to have a white flag march and take some of my difficult patients, which I did not understand what is going on, and or the medicines would be difficult to get. And I used to go to the opposite side Chinese doctors, no language connections, no nothing, and he would feel, and after that, and he would give some acupuncture treatment, and I was absolutely blown up by the fact that these people got sorted. I said, how does it happen? In the same area, if you see in a place called in Arunachal Pradesh, they use something called Mishimi Tita. It's a root, and it's very bitter. But the reality is, I used to have a lot of patients with malaria, falciparum malaria, and lots of mental issues because of that. And these patients used to be, everybody would be having large spleens. But the Mishimi Tita that is to give would sort these patients out. And I said, it is not a part of my what you call chest of medicines that I carry in my clinics. So I often looked at these issues in a very big way. Considering the fact that the acupuncturist did a fantastic job, I went on and did acupuncture course stealthily, taking my annual leaves, going to Calcutta to something called the Kutnis Memorial, so that nobody would get to know that I'm doing acupuncture behind the scene. But I learned it. But then it was not very easy to practice. But I did manage to treat many patients with sciatica, back pain, and various kinds of other issues. But I was surprised over there, they used to be treating with optic atrophy, gastroenterological disorders, and God knows what all things. I said, goodness heavens. And of course, I used to take assistance of acupuncture for managing patients with pain and reduce the amount of anesthetic, because I used to be also the sole anesthetist while treating the patient in the peripheral area in the Arunachal Pradesh. So it was quite a thing for me to learn that we don't know it all. That's number one. Number two is, as I told in the Masters in Law, we felt one of the dissertation work was that creating silos reduces the quality of care. And that is one of the, and it also not only reduces the quality of care, it increases the cost of care, and it is definitely a negative impact on the what you call on the healthcare system. Thirdly, Dr. Khan's approach was fantastic, because there's a common saying, particularly we amongst the orthopedic surgeons. We say, if you want to save money from an orthopedic surgeon, keep it in his textbooks, because he never opens it. And that is one of the approaches I follow. My brother told me, he's a pathologist, and he's practicing here in India. And he said, what has happened to you? Your blood sugar has gone haywire. I said, I've never close to I've had tested, they've never been found to be diabetic. And lo and behold, 3 months, I studied like a madman, despite the fact I was an orthopedic surgeon. And I studied every possible thing. And you'll be surprised, after collecting all the information. And I can tell you that the concept is, I'm going to slightly little more complicated stuff for concept of prana. I mean, you're basically trying to make your life out of life. But I found out 7 distinct steps in terms of managing the blood sugar. And I brought my weight down like drastically. I was back to normal in 6 weeks. And in 3 months, my HbA1c was all normal. And I got all my kit for myself. I was told my brother and the diabetologist are going to take these medicines. I did not take any of those. And I just took it for 3 days or 4 days. I said, as an orthopedic surgeon, I don't believe in drugs. Get rid of them. And I did it all by myself. Lo and behold, where did I get the information ultimately from? I got it from the Shushruta Samhita, no, the Charaka Samhita. Everything is there. Everything is there. And I collected all the information and then made my own, tabulated my whole thing. I have not read it from anywhere, but I took it from various places. I've got my own chart. So maybe I can share it with Dr. Khan sometime in future. And I share it with the people who have been working, trying to get integrated service. Mental health services, as a back pain and pain, as a spinal surgeon fundamentally, I get lots of back patients. And I realized how bad it was to depend on MRI scan to make decisions. And an evaluation of amount of pain the person experienced and our decision based on the MRI scan, I found only 19% correlation because I used to put endoscopes and find out where the pain was coming from. And that correlation was completely threw me out of this field. I said, I don't trust any decisions I make unless I hear the patient fully. And you'll be quite surprised. I found that the matters were much more, not merely spinal, but there are many other issues to be addressed. Once you address those issues, I think this also would get resolved. So I think I will keep my mouth, I'll keep myself shut a little further because it's an enormous field. And it is very bad to really put in all this together to talk so much. But I've got two issues, simple, straightforward questions. And that is where I think we will have to be focused, and that's where I seek all the assistance. Number one, there is, of course, you know what Neil Bohr said about finding out atoms and the things. There is something called the Drik Drishya Viveka. I don't know, I mean, all those people, many other people who understand. It's a relationship between who is seeing and what is being seen. And the fundamental relationship between Drik Drishya Viveka is that we are being judged, or all the people who are doing this other systems, non-medical systems into the system, they will be judged by a particular system. So you have to have these glasses. And the question is how to make all the systems to be possibly correlated in such a way that it could be understood by others as well. So how do you develop a right type of scientific methodology to be able to make it possible for us to express to everyone? And number two is a very, very subtle part. Other medical systems do not make a diagnosis entirely based on the same concept as our traditional, our what you call scientific method, so-called, tries to see. Our science in Ayurveda is interestingly far more rigorous than the conventional system, which takes into account only what is externally calculated, but not internally felt. And that's a major issue in the healthcare systems. And how do we get that things together? It's a very, very complex process. And I'm not very sure how we're going to introduce that system in a big way, unless we use the methodology correctly. And let the scientists also know that the typical Newtonian system of understanding science is quite different from the quantum concepts. And we have still now not moved into the quantum field. And that is a tragedy. And that's possibly keeping us away from making advances. And I think we need to do that. Thank you, Dr. Gupta.
So good. It's so good. And I think, it's just interesting to see it all coming from your heart because you do believe in it. And this is so good to have so many people who have their heart and into it and making a full contribution to this integrated health practitioners organization, a reality. It's not just a myth. It's not just a platform. It's not just an existence. It's a reality. And there are challenges, as you expressed, bringing all these together, people being trained in a different way, people being given a different concept. It's not easy, but if we put our heart and soul, it's going to happen. Anything you want to say before? I'm just conscious.
Yes,
to bring Manish.
Yes, exactly. Dr. Gupta, I had one small thing that in my research on disc pathology and what was causing pain, one of the major questions is to come is what type of genetic changes are bringing about producing different type of cytokines and prostaglandins in causing pain at neural levels. And my next question is to be, what is bringing about that change? And I suddenly found it could not only be just the genetic change locally, but the genes can be made to change differently by conscious thinking, number one. But more importantly, things like the particle physics that you're coming with, the bhasma, the studies on bhasma. And I'm amazed to see so much of this going on in terms of this kind of understanding. And I'm sure lots of things will come in like that.
Amazing, and we would love to involve you because there is a research group within the IOIHP, the Integrated Health Practitioners Organization. And I'm glad to bring also Manisha, who is a researcher in herself and working on a trial called April Trial Ayurveda for promoting recovery in long COVID.
That's lovely, Dr. Rajiv. In fact, to have all these people around, and I completely align with what Dr. Anukul has been talking about. And I think the concepts of Ayurveda, where it is based upon not just viewing or examining the patient from the basic parameters of his vitals, but beyond that, and where we check the Sar, Sahan, and Sattva, Satamya. And all these words basically are those group of things which are including the life force as well as the energy, the vital energy that an individual holds. And it has been a big topic of research in many of the countries where I address traditional medicine conference, and paper has been presented on at various levels where many well-being centers are working on these concepts of diagnosing patients on those basis, because that's where the parameter changes, and you cannot correlate with the intensity of pain with the diagnostic criteria. And that's why the praman concept of Ayurveda, where it is about aptopdesh praman or yukti praman, where the Charaka completely says very clearly, use your logic, use your brain before you make a diagnosis. And that's where what he's talking about. All these things, I think, has got a very big relevance. And I can correlate with all these things to integrate the need of understanding the patient's pains and other things. So very well done. Please stay around, Dr. Anukul and Dr. Rajiv. It's time to talk to Manisha, what she has to say. A very global namaste to you, Manisha.
Namaste.
Well said, Amrita. It's so wisdom words that you add to, for people who don't know, Amrita herself has got deep roots into mind, soul, and practice, and bringing, like, the technology with the mind, soul, and body practices. And Ayurveda and yoga is based on that. So it's really, that's where her wisdom is kind of sprouting naturally out. And there is a conference in Monday in future. And if unfortunately I'm not able to go, and I promise you, sorry, I've been snowed in the work of variety of things, as you know. I would send you some paper. I wouldn't be able to come, but at least I had a long chat. So Dr. Anukul Goswami might be able to represent us and the organization. But that is something, a concept. We need to work together. More people work together, more organizations work together, more it is going to come into reality rather than just talking. And money,
exactly.
Example. Sorry, you want to say something, Amrita?
No, please proceed, Doctor.
And Manisha, although she's a researcher currently working in the NHS on this research trial, she is herself a Ayurveda professional and improving health through the diet, lifestyle changes. And she's so energetic and professional in evidence-based practice. She's very keen, leading some, standards research and patient outcome changes, which doesn't exist due to the fragmented care. So I and she had long discussions in the evenings on multiple occasions, but let me bring her in to express it to the public. Welcome, Manisha. Global Namaste.
Global Namaste. Thank you, Healing Earth, for organizing this program. And thank you, Dr. Rajiv Gupta, for giving me this opportunity to share my thoughts on integrated health. So as you have already mentioned, I'm an Ayurveda doctor and a clinical research practitioner managing clinical trials in the NHS. And I believe that integrated healthcare is the way forward. I second Dr. Khan's approach and practice same principles. And my vision is to see Ayurvedic doctors sitting next to NHS doctors. People on this forum and in the society will say or will ask a question, is it possible
but I think it is. Yes, we can do that by encouraging equality and inclusiveness, and I believe by sharing knowledge and practices also. So and I truly feel that we can achieve this by having something what you have already shared, interprofessional integrating program. And I would like to take an opportunity before I go on and share something more about research and what I'm doing. But before that, just to give some more focus on what that idea is about interprofessional integrating program. So I would like Ayurveda professionals or complementary practitioners to become a member of the International Organization of Integrated Health Practitioners and to get themselves enrolled in this program, what we are thinking of, which is an interprofessional integrating program. So it's, as of now, we are thinking it to be a 2-tier program. So tier 1 would be becoming a member of this organization to get a platform to join like-minded people to discuss or to access, gain access to events or to access medical and scientific journals and take advantage of the online library, which we are thinking of planning to improve your knowledge and to keep yourself up to date with what's happening around in the world of medicine, in the world of integrated health, and overall, what we can say is not only just physical health, but health, mind and soul and body, everything together. And tier 2 program, what we are planning, or which is more close to my heart, would be enrolling into a program which is going to be a standardized or standard structured program to ensure that the members have required knowledge, training, and competencies. So that you can be very well included or accepted by the NHS doctors. So what we are looking at this program is to include mandatory NHS trainings to the professionals taking part in this integrating program. For example, mandatory NHS training such as informed consent, GDPR, information governance, simple basic life support, because we do understand, or we have come across professionals who were trained few years or few decades ago and are practicing privately here, but are not aware about current BLS NHS standards. So keeping everyone up to date with the current NHS training, thereafter learning basic principles of other branches of alternative medicines as discussed, because we would like to bring all the professionals under one umbrella and everyone together, so that when we are having patients, we can discuss those patients and see which medicine branch can offer, for example, correct treatments or best alternative or best care. So for that, we need to understand each other's practices as well. So offering some basic principles of each other's branches of medicine, understanding what are the changes happening in medicine. For example, NHS has started encouraging health and diet, lifestyle changes, but we can take it further and include Ayurvedic principles, diet and lifestyle along with that, and encourage people to follow those diets according to season and their prakriti. So we can take that NHS diet and lifestyle advice one step further by including this and by understanding the principles. Apart from that, we also are thinking of developing evidence-based practice. That is by having standard pathway of examination, assessment, evaluation, and documentation, because as we all know, documentation has got great encouragement and emphasis in NHS, because we all know that in NHS we say, if you have not documented, that means it did not happen. So this is what we are trying to do. We are trying to encourage and put all these skills together so that we can have a structure or an organization which can bring all integrated medicine faculties together to offer a platform where we can treat people after to support or to fill gaps within the NHS. So we are thinking of having this basic training And these are, once the person completes this training, then probably there'll be an assessment for every individual. And after that assessment, we are also planning to provide accreditation. This way, organization will ensure that all practitioners have appropriate qualifications, knowledge, and training to follow standard practices and procedures, the same way how they are followed in the NHS. And then every year we will have CPD training programs, and we'll make sure that the accredited members are practicing and planning treatment and care as similar to after MDT meetings, as similar to the NHS standards.
Perfect. That's very wonderful.
And
Manisha, in fact, yes,
and
please.
apart from, and this is one part of developing a community with integrated medicine, and along with that, we are also aiming to develop community awareness by approaching societies or cultural organization or medical forums to increase awareness and making people realize that they need to ask their doctors for alternative treatment options. If they don't ask, the doctors are not going to guide them towards the integrated society or integrated doctors.
Yeah, perfect.
This was just a short thing about the integrated program. And then very quickly moving on to research. NHS believes that today's research is tomorrow's treatment and encourages research. And that's how I also got an opportunity to be a trial manager for the trial, which is known as April. That is Ayurveda for promoting recovery in long COVID. And this was, or rather is, a randomized double-blind trial using ashwagandha for recovery in long COVID patients. So here, what we are trying to do is we are trying to establish ashwagandha not as a supplement, which is over-the-counter freely available, but we are considering ashwagandha as a drug. So this trial has passed all the stringent regularity authorities of the MHR, from the MHRA to the research committee. And it is currently recruiting patients through NHS GP doctors. So as mentioned by Dr. Goswami, everything is there in Ayurveda Samhitas, and we need to share it with the world in the language they understand, which is through clinical trials or through evidence-based practice. So we need to develop evidence practices by conducting randomized controlled trials and by providing safety data and evidences on Ayurvedic medicines. And for that, I think we need to also encourage Ayurvedic pharmaceutical companies to prepare Ayurvedic medicines using good manufacturing practices, standards, in order to get accepted as medicines and not just herbal supplements. And I'm sure this will change allopathy doctors' mindset, and they'll be more inclined to accept and include other medicines to have a holistic approach in treating patients.
It's very helpful, Manisha.
That's very wonderful.
Sorry, Amrita, go on.
Yes, Dr. Rajiv, I think it's really wonderful. What all things she has put forward is those concepts that we all have been talking about in India related to Ayurveda, promotion, globalization of Ayurveda, standardization of Ayurveda. And over and above, I would like to add on this that there is a question that is also in the chat box: can an Ayurveda doctor speak about importance of potency and safety of Ayurvedic herbs and medicines? Yes, that puts on with the same answer that Manisha has said. It also needs the standardization, certification, as well as GMP practices that has to be adapted by people, and all those people who are certified in the field of traditional medicine, integrative medicine, as well as our healers need to be certified, or Ayurveda practitioners have to come under one umbrella of certification, where the protocol of standardization would be same, the protocol of practices, as well as the policies, rules, and regulations that are implemented on them, has to be same in different forms what they have been practicing. And I think that will bring out a common protocol of standardization as well as safety measures in terms of utilization of the herbs and drugs worldwide. And that puts up as an answer to the question that has been put forward. And this kind of work, Dr. Rajiv, where a lot of work has been done and is being in process in terms of standardizing various medicines, whether it is in the form of the ras kalpanas, or it's in the form of like the metal preparations or the herbal preparations, where various departments in terms of biotechnology, bioengineering, nanotechnology are working at various research institutions in different level in India to put forward and standardize these things, but the process will take time. This is what I have to say. I think we have a quick comment from Vaidya Rajan Patankarji. We take that and then over to you, Dr. Rajiv. Thank you so much.
So,
Vaidya Rajanji, please unmute yourself. We can have your comment. Thank you.
it's so good that you have added, and this work is already need doing from India, and we started doing that word. As Manisha mentioned, we had a lot of conversation and a lot of work is going through this international organization of integrated health practitioners, a lot of setting up the standards, different parts, where membership, accreditation, the whole process. It's a long work, but that's going, and that is exactly as you say. Then we can say standards are same, the protocols are same, abilities are same, everything, and then you can transport. Otherwise, if the standards are high here, low here, people will not accept, and people can transport their abilities, skills, because ultimately all human beings have same potential, same abilities. It's just they have fallen into a trap at times, and therefore if we can untrap them thinking and abilities and add where the gaps are, fill the gaps, so that that becomes universal. And imagine a world, how powerful will it be when people can either help people through different disciplines themselves, or have the camaraderie or a whole family of other practitioners who they do not have any animosity or any hatred or even a hesitation to refer in case where their abilities finish, somebody else's abilities start. But the patient get the best care seamless. And that's the aim which we are going to have. Thank you so much. Let's have a comment from Rajan Patankarji.
Perfect. Are you able to unmute yourself, Vaidya Rajan Patankarji?
Sunny, you want to say something? You are next anyway to speak. If not, then Rajanji, can you unmute? Or if not, then we can get to Sunny. You want to say something? Go on, Sunny, go for it. You unmute yourself. You are still mute. Can we do at our end something, Nishit, to unmute Rajanji and Sunny? Looks like they're muted. Let me try myself if I can. Here we go. What is happening here?
Okay. Yes, yes. Thank you, thank you. Only one thing to add, as Manisha ji has said very perfectly. But in my opinion, nowadays, the standardization of the herbs is also important. Then the manufacturing process, if it is not done as per the Ayurvedic text, it also has got side effects, because side effects are there in Ayurveda. If the processing is not proper, and the herbs which we are having, especially in India, if they are not proper, and the processing is, in my opinion, utmost important thing. So, thank you. Thank you, Manisha ji. Very well said.
We're going to bring Elaine in, but Sunny, any quick comment? Yes.
Yeah, hi everybody. It's been absolutely a wonderful session so far. What I am just wary of right now is that it seems to be is a debate between Ayurvedic intervention and the conventional medicine. But I thought integrative medicine is all about all the ecosystems of medical intervention. You got the acupuncture, you got the Ayurvedic, you got all the other options. So if the debate here today is all about Ayurvedic and other conventional intervention, then the discussion has to be made clear. But if it has to incorporate like the Chinese acupuncture and all the rest of them, that should also reflect on the discussions and also those practitioners who should be on the platform to discuss and express, because this is such a vital topic that we are discussing here that can impact globally the medical and the patient community at large.
Wonderful. So that's correct. So the idea is we are discussing the differences and the synergy between different systems. And if we and it's good to give chance to people to express their views or what the differences are, but more importantly, how we bridge the gap between different systems so that we move to the same single pathway and have the bridges. So there is all, I say, diversity, but also a synergy of the system. So I think we will invite you back to talk in a few minutes, but let's get Elaine, who's probably waiting there. She is quite keen talking about the behavior, the mind, the body, and helping people to cure the physical disease through the behavior. She is quite, a health mentor primarily, but also an entrepreneur, do behavior profiling, and also is very keen to achieve the optimal wellness through understanding of the critical connection between the behavior, mindset, and personal health. So Elaine, if you are here, we can bring you in. If not, then we can get to Sunny. Elaine is here. Can we help unmute Elaine? Nishit, we are having a little interesting time today. But the whole part is that mind is the perfect part of the body that controls the physical body. And if you know that the neuro-linguistic programming actually tells you that you can program your mind in a different way in order to do that. And I have attended the whole university and the mastery from Tony Robbins, and I have been a crew in his events like Unleash the Power Within, Wealth Mastery, Life Mastery, Date with Destiny. There are various programs, and you can see I have walked on fire myself. Being a medical person, neither I could believe earlier or my colleagues still don't believe I could, but I have walked barefoot onto the burning coals with 230 degrees centigrade, and I did not have any burn. On 2 occasions. Then the third one, my state broke, and I ran to try and get camera so that I can show to my colleagues that I could do it. We are not supposed to take our cameras. It broke my state, and I had a blister in my foot. And that is just a proof to myself that if your state break, you have a problem. And if you are all aligned in your mind, body, and the whole universe together, it's unbreakable state, and you don't have any physical illness. So if we have managed to get Elaine, we can move. How do we do that, Nishit? Can we unmute Elaine?
Here we go. I just need to share my screen, please. So if I've got permission, the host can help me share my screen, please. That would be very good.
You can keep talking while Nishit try to do that.
Okay. Cool, that's lovely. So I'm going to be coming from a completely different angle. So I'm not a doctor. I am a trained nutritionist and a biohacker, and I've got a lot of experience in the corporate world and how the impact of poor health affects industry and office workers and so on and so forth. So I'm going to be coming from that angle. Let me see if I can share my screen yet. Share. No, I still can't share my screen. Hopefully that's going to happen shortly.
Talking, Elaine.
I'll keep talking. Okay. So what I wanted to talk about was emotional intelligence and burnout, and how we can use the concept of how our behavior affects our health and well-being. It's so important. So when I specialize in the DISC model of behavioral profiling, and I've created my own tool which looks at how the behavior affects the health and well-being. So I draw from the DISC model. So the DISC model is very popular in the world. It's one of the most widely used. If you Google DISC, DISC, you'll come up with direct, inspiring, supportive, and conscientious. They're the key words. I use slightly different words, slightly softer words. And I've created, no, still can't share my screen. I've created a link between our behavior styles and the types of illnesses that people are predisposed towards. And this isn't my idea. I've just kind of brought it into this century. It started with Hippocrates in 400 BC, and I'm sure you all know about the Hippocratic Oath. And he was a doctor, so he identified the 4 humours, and it's now turned into the personality styles. And there's loads and loads of tools, but the one I have created, I work with students to help them to identify what their behavioural characteristics are, so they don't go into organisations and roles that don't suit them. Because if you've got a day-to-day behaviour pattern that doesn't suit who you are, if you're not being authentic, that will cause health challenges. And so that will, that's not a happy place for anybody to be in. So we end up with the over medication. Somebody's anxious, somebody feels bullied, all these things in the workplace. A lot of them are avoidable, and it's simply the mismatch with the personality styles. So I've created a way which brings out a 22-page report. We talk about emotion intelligence. Emotion intelligence is about being aware of who we are, what our key characteristics are of behaviour, and then managing ourselves. Somebody mentioned earlier on about health is in our hands. We should not go and outsource health to the doctor, turn up, say, fix me. There was a statistic I heard the other day in nursing homes in America. The kind of managed care for older people in nursing home type of establishments, they are on 48, an average of 48 medications. That's an average. I mean, that's just ridiculous, absolutely ridiculous. But the over medication is just, it's just gone mad. And one of the, it's a lovely concept, the integrative model, and I've used it myself many times. But how are you going to persuade the allopathic doctors who are paid by the big pharma who train in the medical schools? How are you going to persuade them not to take the money? Because a lot of them, unfortunately, it's not about the health and well-being, it's about the money. I'm sad to say that, but a lot of doctors start with a kind heart and goodwill, but they get tainted along the way. I've seen it many times. So going back to the behaviour thing, very simply, the sooner somebody as a young person gets to understand what their behavior characteristics are and how they can manage themselves, this is the first part of the emotional intelligence piece. So understand who you are, what your strengths of behavior are, and then manage those. So that's the first piece. The other piece of the emotional intelligence is noticing how you differ to other people and how you can manage that relationship. And that has an impact on your friends, your family, your work colleagues, doctor-patient relationship, whatever industry or sector in. I would do a lot of work with lawyers and accountants, and I work with the leadership teams to help them to understand how their behavior is impacting on the people in their team, because 9 times out of 10, the people in the team who are doing the work, they are a completely different behavior pattern to the leadership team who are supposedly leading, but all they're doing quite often is causing chaos and confusion, which then ends up with the people in the team being ill, thinking they're being bullied, but they're not necessarily being bullied, but because they're kind of more sensitive, softer behavior characteristics, they take everything on, they internalize things. So we end up with people who are extroverts displaying certain characteristics and health challenges. Typically it would be burnout, taking on too much, thinking they're superhumans, as I did many years ago. And the kind of more gentler styles, they would be internalizing. So they would be having conditions where you're holding on to things. So internal gut issues, migraines, arthritis, that kind of thing. Whereas the style that I have is more burnout. So I've created a model that can help with all of this. But the key is to be yourself. So be authentic. When we're not presenting as ourselves and we're presenting as a mask, behind a mask, how do we know when we're meeting somebody whether we're meeting the mask person or the real person? We don't know. There are some ways that we can tell, but generally speaking, you can't tell unless you get to know somebody. So this is a quick way on finding out, and it's just a simple questionnaire. It takes about 10 minutes, roughly speaking, and it's behind my website. So I use that with students in schools in Nottingham in England. And the reason I do that is because I wasn't happy at school. I was a sports person. That kept me going through school. I hated school. I used to bunk off in the days when it was allowed and we weren't tagged, and goodness knows what they do to the kids these days. But I was continually told, put up, shut up, sit there, don't ask questions, don't be curious. And I probably would have one of these newfangled labels if I were to be bothered to go down that route, which I'm not going to do. So it's about being authentic, and the more authentic you are, the happier you'll be, the healthier you'll be. You won't be creating all these problems within your body. So it's all about prevention to me, and taking control of your own health and well-being, not outsourcing it. Be your own person. But I have experienced the integrative model myself. I've had 2 breast cancers. My first breast cancer was in 2009. I had another one in 2011. And then in 2015, as I mentioned earlier on, I was given less than a year to live with stage 4 Hodgkin's lymphoma. And each time I've dealt with the challenges, I've used an integrative approach. I've never gone down the whole medical model because I didn't trust it. I didn't believe it was going to work. I've done my own version of things, and with the studying I've done over the years as well, the qualifications. But also I was born with a kidney disease. I'm told, and if you Google it today, it apparently, according to the medics, it's still an incurable disease, medullary sponge kidneys. And I was a competitive swimmer all my teens, so it got kind of hidden by the chlorine in the water. Oh, it's the waterwork infection again. It's the chlorine and so on and so forth. It's the chemicals. So it's not just about the lifestyle thing. It's about the environment, who we mix with, the chemicals that come into our environment in the house. There is thousands and thousands of chemicals in the house, the toxins, the plastics, every which way we look, there's toxicity, and we can help protect ourselves, but we're not taught it. So there's an awful lot of information that hopefully will be shared within this community on how we can take common sense approach and be preventative. So I beat my kidney disease in record time through chiropractic care and nutritionist. And I still use today with clients the hair analysis that the nutritionist used with me over 25 years ago. And it's a hair analysis, very, very simple, very easy. and it shows what the mineral imbalance is. And there's so many of the health challenges are as a result of mineral imbalance. And of course, with the menopause, it's minerals affect your hormones and so on and so forth. So there's lots of very simple ways that we can help people. I used to run cardiovascular health clinics, and I've taught cardiologists about the importance of nitric oxide to enhance the oxygen levels and so on. So there's lots of different ways that we can help. And I've created a health hub now. So I've got a community, a tribe of health practitioners who are all practicing various different types of healing devices or services, or whatever they're doing, lots of different types. So if I don't know the answer to something, I know a man who can, type of thing. So all of this joined up stuff is so important. It's not about competition. That I was brought up in the era of competition. It's not competition. Collaboration is the new competition, and we have to work together. Absolutely have to. And if we don't, we may as well just go home. But at least we can impact our own little bit of the world. And forums like this are exceedingly welcome. So thank you for the opportunity, Rajiv. And it's lovely hearing some of your passion. Some of you who are, getting quite excited about what you're talking about. It's really quite refreshing. So thank you. Any questions? Rajiv, no, you're muted.
That's great, Elaine. That's fantastic. So I think the message is quite powerful, and again, it indicates we are all human beings driven by emotions. We all want to go towards happiness and want to avoid pain. And that is the basic purpose. And whenever the body is actually having any departure from health, a part of contribution is the physical part, the organs, the systems, but also a part is the brain. And at times we know that there is no physical cause for pain, and brain is perceiving pain. That is because of different part of the pathways that are causing the false signaling. And it's really good to hear that these all can be effectively dealt in some or the other way through the modification of the mind, body, emotion, behavior. And many people, we know that there are people in the battlefield whose arm is blown by the bomb or something, and they're still walking, marching. This is there. How is it possible? Well, there are people with little needle and they're crying in pain. And this is because this is how we behavior modified people can control or go over their physical problem and mental problem through the system. So very, very good. Thank you so much. I think Sunny is online, who's the next speaker. So we can bring him in.
I just have a question for Elaine.
You have a question?
Sure.
Elaine, nice to see you here on this particular platform.
Hello, we've met before, haven't we? Yes.
Yeah, we met before. What I just want to ask, I mean, you have a story and a half to tell us in terms of what you've gone through. But is there any time you ever have felt that you want to give up? And what happened to you?
No,
Why
absolutely not? No, my personality style is extremely robust. And somebody tells me not to do something, I'll do it twice as much. So somebody tells me I'm going to die, they can, as my late mother would say, off is the second word. You can guess what the first one is.
Very good. Excellent. Very inspiring.
Cool. So I think that is amazing. Thank you so much, Elaine, for speaking from your heart and actually bringing these two different spheres, connecting them, and to that you would have a great contribution for this integration process, because that is quite important, that we have different spheres and they all connect, so that what is a small ball that a human body or a system actually has connection all around and become a snowball effect and percolates and goes across the universe as it is. And through healing our earth, we are trying to do it in this aspect. But let me bring Sunny, who is actually other very vibrant person and has got a variety of things. It's interesting to see that, he is expert in bio-natural medicine, and that is something very innovative and interesting to bring the natural healthcare together. And he also has a chartered accountancy, so that parts of that. But in other aspect, he's also a social entrepreneur with like almost 4 decades of experience. And when I talk to him on multiple occasions, how we can improve the health through a variety of things, and nutrition is a different part, and we can have different type of treatments, but also we can have a variety of supplements because our diet is different now, stress is different, and there are preservatives in food. So all that is there, but mind, body, physical health, all can work together. So let's hear from him, and then we can open up for some more questions. Over to you.
Okay. Hello, everybody. Yeah, if I made a co-host, I just like to share one or two bullet points.
Yes, so
Yes,
keep
please.
talking, and Nishit will try and see when the
Yes. So as Dr. Gupta had just mentioned, it's been an amazing journey, and to put this together is no joke. So a journey of 1,000 miles, as the saying goes, starts with the very first step. I think the new beginning had just started. Well, not started now, but many, many years ago, but it's all about building blocks. Yes, I qualified as a chartered accountant many, many months ago, about over 40 years ago. And I practiced in the accountancy field before I moved into health and wellness 22 years ago. But my own health had, my own research has actually gone into so many aspects of health field, but particularly how technology, emerging technology can impact health provisions. My current specialization is mental health and clinical research as a psychologist in the process. Yes, I've been through so many trajectory in terms of education and training and research, but it doesn't stop. I am the founder of the London Bio-Natural Clinics, which provides an integrated system. I don't call it complementary. No, it is not complementary. In fact, that's actually insulting to the whole approach to integrative medicine. It's integrated because it integrates all the whole ecosystem. And I'm sure this particular platform, that's what we are designing to do here. So next time we bring also the Chinese and other dispenser in terms of
free to
healthcare
talk, because we are
and
open to
approaches.
all, Sunny, we are open to all. We have got the people who are from Chinese medicine, Indian medicine, because all of these different medicines have survived for long, and we bring it all together, and they all work in some aspects better than the others. But
correct.
Trying. So yeah, please. And
So
mental
can
health.
you all see my screen right now?
We can't, but you keep talking.
Can you see my screen now?
We can't see it yet, but
No, we can't see anything.
don't worry, just keep talking, Sunny. You
Okay.
can whatever
Yes.
we can
I mean, what my presentation is all about is now we're looking into generally the integrative medicine, but I think my first approach is to appreciate the work of conventional, what we call the conventional medicine, because they've done a lot of work in terms of research, diagnosis, and they help us to understand our body and physiology quite a lot more. So we need to give a lot of credit to the established medical management. Yes, there are drawbacks in terms of what it is, hence the reason why we are discussing right now issue relating to alternative or integrative medicine. Now, what is my presentation all about?
Dr. Sunny,
Yes.
if you click the green share button on your Zoom bar.
That's what I was trying to do, because I use Zoom every single day and I don't know why. Okay, yeah, that's the one. Okay, I think you're all able to see my presentation now. Share.
If not, don't worry, keep talking.
Now it's shared.
I can see it's coming through now.
Got it.
Right. Okay.
If you click on present, then you should be fine. It'll come through as a full screen.
Yeah, it's actually sharing, I think.
Yep,
already.
we can see it now.
Oh, wonderful. Okay, that's my profile, which you can read. I'm helping to, integrative medicine, as we already defined it, it focuses on the whole person, the body, mind, and illness. Why is it to understand the underlying cause, not just a symptom of the condition, but the overall complete, hence the reason why it is called integrated in the process. What are the strengths and what are the weak points for the current strategies in terms of standardized medicine, in terms of conventional medicine? Well, it's standardized. It's easy. Efficacy has already been proven. Strong in diagnosis and research, backed by advanced clinical research. Very deep understanding of human anatomy and physiology. So we have to give those credit to the current Western-based intervention. But are there drawbacks? Of course. In life, this is where it lacks individuality. Everybody is giving the same treatment. If I have headache, Dr. Gupta had headache, and we go to Elaine will prescribe with painkillers, the same. But Dr. Gupta may be different from the reason, the causal factors. So it's not able to look into the causes of what is actually happening. And very, very resistant to change because it's highly dependent on the big pharmas. That's a different topic that we're going to look into. What are some of the advantages, of course, of integrative medicine? I use the mental health because that's the area, but in general, this presentation covers other areas of medicine. Well, integrative, hence it's called integrative, has a 360 approach. Therefore, it benefits the practitioner and at the same time, the patients alike. It draws from the Western Ayurvedic and other healing ecosystems, which makes it really, because a tree doesn't make a forest. It deals with the whole person, body, mind, and soul. So the true meaning of integrative should be really be part of the whole medical education management. So you should start from the beginning, not at the end. Students should be conditioned to be able to do so much so. Why do we need an integrated approach in medicine? But I just use the word psychiatrist here. Changing patients' expectations. Because patients, they like to be involved. They like to be the, not just the doctor having the CNC control and command of their own. Dr. Gupta mentioned earlier that we as patients, we are in control of our own health. And that was alluded to by Elaine in part of her comment. Yes, long-term solution is actually a preferred method of what it is. In the clinical research in terms of mental health, what are some of the issues? Well, this is one of the very rare area of medicine. And in fact, it is not understood by the medical community a lot. A lot of research that has gone into here, and it's a very different type, very, very unique, because here you are dealing with the unknown. That's what makes it really, really different. Very challenging, very, very intricate, complex area of medicine. But are there solutions? And what will integrative approach, what has integrative approach done in terms of this area in recent times? Well, here I've compared, you can read all of this when I send you the Dr. Gupta, we have this one, and anyone who wishes to have a copy of this presentation can have it. Complex and nature of mental disorder, very, very complex, as I mentioned earlier. And it's very challenging to diagnose. How can you diagnose things that you don't know? And this is the issue. So this is where the intervention that will be brought in by a medical physician practitioner, when you infuse that with Elaine emotional areas, then you're able to provide the patient with what is called talk therapy, that soft medicine that doesn't involve any sort of chemical being given to the particular patient. And what are some of the future trends that we have seen, we have analyzed? Well, it's interesting to see that 33% of America use integrative therapies, according to the survey of the NCCIH, 33%, moving away from allopathic intervention, the traditional based intervention. That's quite a high number. And the trend also in the UK and all over the world is pointed to the same conclusion, that the increasing trend of patient, and in fact, a lot of medical practitioners that I work with right now in my clinic, they're equally in favor, although they cannot say it out because this is what it is. But we need to get to that point. 82.3 billion by 2020. That's the annual market. You can imagine that's about 5 years ago. So what's next? More healthcare professionals should be involved, and at the grassroots level, everybody got involved. And hence, that's why this particular platform that is being created now and spearheaded by Dr. Gupta is actually a refreshing contrast compared to what the trajectory, what the status quo had been. And I think it's only a beginning that will bring in a lot of good things to many, many people around the world. So what are the takeaway here? How do we improve medicine in general? Right? These are some of the things actionable that we can all take in order to reduce cardiovascular, in order to reduce mental health, in order to reduce all the different. Research insight. Growing market, yes, it is going to grow. Integrative will grow beyond what it is today. And it can only grow when we make that noise loud and clear, emphatically. And the resounding voice of all of us together. The politicians are not the one to change the status quo. They're not the one to change the landscape. Are the practitioners themselves that need to have the desire and to break through those barriers that has been brought about. I've only just done a very short case study with a product I use myself. This is not to sell any product, but this is an intervention of a product that optimizes. It works with your whole molecule. This is one of the research products I've been researching on over the last year or so, and which I've used myself. But a case study actually came up, how this product, the doctor, this is a case study of Amelia, a malaria recovery process. This patient of mine came in contact with her around about 26th of February last year, almost a year right now. Doctor has already given her a written of a palliative sort of instruction to go home and die. And you can see why that is the case. This is her own condition, right? It's a rare autoimmune disease, bullous Papillongo, that really strikes so many, very, very few people, 1 in millions, but she happened to have that. And that skin disorder, the intervention using the traditional Western-based intervention couldn't. And an integration was brought in. And over the weeks, this is what happened to this same particular person who is now 3 weeks later. Sorry, a few days later, this is what happened. Let's see what happened 3 weeks later. This particular same person, can you imagine that this is the beauty of, can you imagine that? This is intervention, and this is the beauty we're trying to promote under the integrative approach. Yes, one tree doesn't make a forest. So one interventional approach doesn't provide solution for the patient. So I think the overarching issue is how we can support the patient rather than looking into, yes, our own status as medics or medical doctor. But we know there are some challenges along the way through the big pharma. Here, we're not condemning the big pharma. They've done a lot of job, acute pain, short term, all of that. A lot of work has gone into it. Let's give them the credit. But we, as all practitioners, we need to take the home by the bull, the home by the tail, the home by every part of the home. We need to take it. And by using this particular platform as a formidable platform whereby all of us will come together to create that communication that will establish, yes, as overarching body, incorporate mental health researchers and other aspects of it, developing curriculum of schools, School of Medicines, so that all these young brains are shaped and conditioned right from infancy, and that will grow up with it. So a journey we started, and let us all come together and make this a reality, louder and much louder and much more. Back to you.
Amazing. Thank you so much for the wonderful, wonderful wisdom and the concluding thought as well. And I know we have talked on multiple occasions, and Sunny is very, very dynamic, and he is going to be he's one of the ambassadors for the IOIHP, the Integrated Health Practitioners Organization. And this is an organization which needs to grow, and he's very keen supporting the organization, growing the members, engaging the community, engaging public, so that this mission continue. So please, please, please join the movement, join the Integrated Health Practitioners community. And so here's just scan this barcode for those who are at different ends, or send email to community@thehealthpractitioners.com. And the whole purpose is that gradually we have a critical mass of people. Each of you believe in this philosophy. It's not a movement for us. It's a movement for all. It's a collective movement, so that we can make not only our generation, but the future generation more happy and healthy. So thank you so much, Sunny. I think that if there are any questions we can take, or we can bring, I believe Anandana is another big force. She has got a network of people. She's herself yoga trainer, and she is going to bring in practice and make us do the, is it? Yes, I think she's before you, Sarah. That's great. So she's going to demonstrate how to do the yoga in real life. She's going to talk a little bit, then she's going to share with us how we can do. And this is not just normal yoga, it's the yoga, how different yoga practices can help different diseases. And this is so important. And I have done a lot of research and published the book on the scientific basis of yoga and different parts, different tactics, different. But she's going to really do with us in practice. And please, if you can, join the session with her to see how it works in real life. Simple, easy techniques for living longer and happier. Over to Anandana.
Namaste everyone, I'm Anandana here. Thank you Rajiv ji for giving me this opportunity. It's an amazing platform. I always try and join weekly sessions. I think there's a lot of knowledge shared, and there have been some amazing conversations, and it was really nice to hear everybody out. But I thought you've been doing this for almost 2.5 hours and everybody needs a little break. So before I talk something, I thought we all could just it's just one asana that I'm going to practice, just letting you know that how obviously alternate medicine, one being yoga, can help us in our daily lives. And diabetes being one of the major problems across, there's just this one asana that we are going to practice today. So if you have any space and you are able to get onto a mat or just on your carpet, if you have, it'll be good. If you just don't feel like moving, then no problem. Maybe on your chair, you can try. So what we're doing today is Ardha Matsyendrasana, which is half spinal twist. So obviously, because we are engaging more of our abdominal organs, we are working towards the better functioning for the pancreas and the liver. And this is where diabetes starts, ends, everything. So just this little practice every day can change everything for you. So just sitting in any comfortable position. If you do want to take a wall support, please do that. Or if you're on your chair, just cross your left leg over the right knee. So if you're on the chair, you can do that way. If you're on the floor, just cross it over. Try and keep your foot flat. If you're unable to sit comfortably on the floor, then you can also elevate your pelvic muscle and sit on something. So that's another option. Again, important to see wherever you are, you begin your journey from there and you can go forward. So it doesn't matter. Wherever you are is great. Okay. So folding in and with your right hand, because the left knee is over, I'm going to hug in my left knee. So if you're on the chair, just try and pull the knee closer and twist over to the left. So I'm looking over my left shoulder. Now what am I trying to do here? I'm obviously trying to keep my posture straight. So in that process, I'm nicely stretching and twisting my abdominal organs. I'm igniting the solar plexus, which is the Manipura chakra, right here between the core. So obviously it's helping me open up my chest and twist at my spleen level and move. So this helps me obviously make improvements in my metabolism, which is improving and reducing my diabetes. So I'm really twisting here, trying to make sure that I'm sitting straight, grounding my foot perfectly. So just this much while I'm breathing, focusing, looking over the left shoulder as I'm twisting to the left. So if you've done this on one side, and we come back, straighten, and we go to the opposite side. So right going over. So if you're on the chair, please do that. Right over. Again, hugging the knee into your chest with your left hand, and then right hand goes over. I'm going to look over the right shoulder. Again, the same thing. It feels amazing as you twist near your abdomen, and that is how it's helping my pancreas and liver to work more efficiently, improve my metabolism, and then obviously work on not having diabetes. So twisting over and looking over the right shoulder. So you can do this, like I mentioned, sitting on the mat, or you can do it on the chair as well. So this is how I work with my students, obviously giving them a little more detailed description of how every body part is involved in yoga. From my personal experience, I have had 2 children, and for all the women out there, it's quite a journey. And so I did not take any epidural during my labor pains. So I did everything. I was doing pranayams on the table. So I practically applied alternate medicine with my delivery and made sure that I did have a successful delivery without epidural. So I did not harm my body, but at the same time, I had a great delivery. I did have long labor hours, so I did endure the pain, but that was because I was very actively involved in pranayams. So I did use all of that in my favor and made sure that I don't harm my body. So I think it's I've heard so much information. I know we all are in support of integrative medicine and care and everything. And I really hope that we are able to bring Ayurveda, homeopathy, all those things within NHS, along with a lot of doctors who are also now yoga practitioners, like Dr. Rajiv is also one. I am an accountant, so I work with doctors as well, and I know there are lots of doctors who are yoga practitioners because of obviously the benefits that it's bringing to the community, and people are seeing it. It's more evident, and hence all the more reason that we need to make sure that we are actively involved and supportive of this concept, and hence it's amazing to be a part of this community and support. That's all from me. Thank you, Rajiv ji, for supporting, and I hope you did manage to do the Ardha Matsyendrasana, half spinal twist, and do practice it every day, and please share.
Fantastic. I think it's so good that we have got a variety of people, and Anandana is I like the name. Ananda means bliss and pleasure. Anandana.
Thank you.
Is good, and each part has to play a role. As like, say for example, you're twisting your body and your pancreas in the center of your tummy. If that is being squeezed, your insulin is going to come out. And same is like also in Mandukasana, when you're sitting forward and bending it, you are squashing it to squeeze the juice out of it. There are certain asanas which work, and if we understand why it works, we are more going to believe, and anything you believe in is going to become a fact, and that's going to become a reality, and that will be giving you much more benefit than if you don't know. Because if you don't know, you go half-hearted, it doesn't give you relief. Also, because if you don't believe in it, you will not do consistent practice. If you don't do consistent practice, the results do not come. The Rome was not built in a day. It took a while. And if you consistently do it, yoga is one thing which is a way of life.
Yeah. So just adding on to Rajiv's point, so other than asanas, we also have something called mudras, which are hand gestures, which are just so powerful. It's unbelievable that people do not want to practice a free thing which is available. So with the five elements being on our five fingers, we can do so much to just simply work on diabetes itself. We have like 4 5 mudras just to do that. Linga Mudra, Pran Mudra, Surya Mudra, Pan Mudra. So they are so active, and if you just practice just sitting comfortably with just the movements, with just touching your fingers, it can just do so much miracle. It's just about practice. It's just about sharing the right information across. It's not always just the movement, but also being able to sit and doing the hand gestures, which will just go a long way and really improve diabetes to a larger extent. So definitely, I'm in support of integrative care and always supporting the group. Thank you.
Amazing, amazing, amazing. Do you want to show a couple of mudras for benefit of people which can help any particular diseases? Because it will be great.
Absolutely. So I'll come a bit closer. So just giving a little background, all five fingers represent five elements of our body. So which is fire, air, space, earth, and water. So I've given it a nice acronym, which is FACE, so that you remember. I teach the children also this way. So fire, air, space, earth, and water. We'll just do a simple one, which is Apana Mudra, which is touching the tip of the middle two fingers with the tip of the thumb. So I'm just literally just touching them. I'm not even pressing them too hard. It's also Spider-Man, so you will remember. I'm doing the easier one, okay? So just remembering it like this, and I'm just going to keep it on my knees with my palms facing upwards. Okay, so just flat on my knees. That's all. We just have to practice this for 5 to 15 minutes, starting with 5 minutes, going up to 15, and then obviously taking it up to 45 minutes. So this is how they are connecting. This is connecting my space, earth, and fire together, which is my apana vayu, which is my vayu flowing downwards, which is my digestive system. And just the miracle of sitting like this is going to change a lot of things for you. So it's just about practice again. If you do manage to practice, even say 1 week, 5 minutes a day, come back to either Rajiv ji or me and tell us how you felt. I'm sure you'll have a different feeling, and it's going to be wonderful because my students practice, and we do have sessions where they come and tell me how it worked for them. So a lot of students improve their diet, improve their blood pressure, in fact, without tablets, but just doing yoga and mudras. So it's definitely it's mind blowing. It's just about practice. Yeah, Apana Mudra for you. Just remember Spider-Man as well. Just practice and let us know.
How many of you would want to bring your blood pressure down without pills just by doing this mudra and having like serenity and the control and the whole digestive system? The digestive system, everybody kind of suffer from stress, acidity, irritable bowel syndrome, which is like going through the roof in the modern medicine problems, where you're trying to get the medicines to control this. But if you can control this whole digestive system just by this thing, 5 minutes a day, you can do sitting at your work anywhere. Apan Vayu Mudra, amazing. Thank you so much. You got to the, thank you so much, Anandana. You got some of the people. Let's have a few more comments and then we'll get Sarah in.
I loved that. Thank you so much. I felt even when I was doing the twist from one side to the other, and I have done yoga before, and then doing that, I could feel this really amazing tingling going through my body. Yeah, that was amazing. Thank you. I should remember that. I love Spider-Man as well.
Great, great. It's so good because I always believe simple things are simple but great. Complex things are difficult to follow in life, and people don't do it consistently and they don't get results. So it's so good to see the whole day has gone like minutes. I know we start at 2 o'clock. We are just almost nearly 4:45. And, it's just looking like I have not moved from my chair for a single minute. And it's like you want to be glued to hear more and more and more and more. It's like so powerful energy in the system today. The speakers, the listeners, the universe is combined into one alignment so that we can bring, and health is the outcome of what we do. The physical body, and those people who believe in physical body, but also there are multiple layers, Annamaya Kosh, Mahamaya Kosh, and there are a variety of things there. But real life is that you can pierce through, and we are reaching near to the core now. It is so glue that I want to hear more and more and more and stay in the system, because the integration indicate combining, joining, and the whole day, every single minute has given a new message, and subliminally it has been aligning our body and our soul, our mind, and aligning to the universe. And I think universal energy was pouring on us all the day so that we can even heal our body now. And the people who have been sitting all the day here can find they are more energetic now than they were before starting 2 o'clock. So thank you so much.
Global Namaste, Rajiv.
Yeah.
Rajiv, Global Namaste. Thank you very much. You've been doing a sterling job, and Ananda brought her energy in a simplistic form. You don't have to do exercise yoga. You can do mudra yoga. You can do it sitting. You can do it while you are driving and stopping at the traffic lights. You can be doing at the work. And Dr. Sunny mentioned very simply that let's not call it complementary. Integrated health, what it is actually merging in. There are some ailments that we do need the normal surgeries and things, but then we can go the integrated way. Rajiv, you mentioned as well, mind over matter. You gave an example that an army guy on a war might have lost a limb, but his will to go on and protect his country, mind over matter, is more powerful than somebody who looks at an injection and faints as well. So what a combination of information. People watching us on the YouTube, Facebook, and the website are making comments. They're loving it. So Rajiv, what we will do, we'll go to Sarah now and listen to what she has got for the next 10 minutes, chit chat. And then all of us can do a chit chat for at least 15 minutes to bring some comments. Before Sarah, we come to you. Let's go to Amrita at Jalandhar, because Sarah resonates what Ananda did over there, because she likes yoga as well. So let's have a comment from Amrita, our chief admin in Punjab, and from Dr. Anukul Goswami, who will give a comment. And then we go to Sarah, Rajiv, and then we'll have a multi-chit. Amrita, you resonated what Anandana was saying. Simple, very simple. She was just showing the mudras, which you can, if you learn where to pressure your thumb and your finger and which finger and what point, you can do it sitting anywhere in doing any work, and you can be doing that. Amrita, your comment on that. We'll direct comment from Anukul and over to Sarah.
Thank you, Neil Kumar. Global namaste to you and global namaste to everyone. Anandana, it's great connecting and seeing you after such a long time. And yeah, mudras have been one of my favorite body languages, in fact, which I love. And I have a very close memory of that, which is related to at the time of COVID, when my mom was hospitalized and I was, she's a cancer patient, so she was hospitalized, but I had to protect her from COVID, and mudras have helped me tremendously. And I used to walk, I used to sit just in this mudra and this mudra. So this chin mudra, Gyan mudra has always helped me at that time, because whenever you make mudras, indirectly, your gestures of your hand give you a signal, neurological signal at the brain that your hands are in a particular state, which changes your mind brain waves to a more calmer state and a more mindful state, rather than touching, doing something. Because when we do some certain things in our life, we spontaneously do, which is a very small example, I would say. Have you ever experienced the kind of apps you press in your mobile very often, you automatically, your hand goes despite you don't want to at that time? That's a very clear example of how the brain catches up these subtle signals from the muscles which are in our body to work on these fine movements. And mudras are a very good example, not only just to meditate and synchronize yourself, but also to bring a mindfulness among yourself. So me practicing it in a hospital where I had to avoid my contacts with people gave me a very good resilience to understand myself and being mindful. And your connection of these things with 5 elements, yes, has got a wonderful way to deal with things, as well as their pressure points, their acupressure points as well, and also certain marma points that can get pressed. And these vital points, when you press them, it helps you to vitalize many neurological signals and bring vitality to your body and mind. So thank you so much, Anandana, for connecting all of our viewers with all these things, which are very subtle, but they are yet very important.
Thank you.
Thank you.
Thank you, Dr. Amrita. So you endorse what Rajiv said, mind over matter. Dr. Abdul as well, who practices both kind of integrated and from medical world, and Dr. Sunny. So we are all saying, and Elaine earlier said that she actually trusted herself and integrated methods better. And she is a proof of herself, how she has come out when she was on stage 4. So isn't that fantastic that we are all endorsing that you don't ignore your medical doctor, don't ignore them, but have a faith and a belief in self. The power of mind is so powerful, it can control your immune system if you allow it to. So don't give up on that. Anukul, you are an expert surgeon, a pediatric surgeon, but you started practicing integrated health in a big way. A quick comment from you, and then Rajiv and Sarah will take over for 10 minutes, and we come back to Multijet. Over to you, Anukul.
Thank you so much.
Thank you. Namaskar, Nilji. This is, I think there are 2-3 very important comments I wanted to make, and it does come along all the time. Is control over the 5 senses. It is not a small thing to do, but it's something that you have to learn very early in life. And therefore, I'm one of those proponents of the Gurukul system of education for children. Number 2 is to try to train people toward a sense of duty rather than rights, because the number of people who come to the clinic and say, I should have got this, I should have got that, or complaining about this issue or that issue, I think it does sometimes show a mindset that I have got no role to play. It is for you to make sure that it is all goes right for me. So it is not a very easy thing to understand that mental makeup, and that happens only when those kids say, yes, I take control of my life, I take control of my 5 senses, I have my duty towards myself and do the things the way that I want to do. And lastly, not possibly not the least, is that we have now to find out some means of communicating what everybody said. I think Dr. Amrita said some fantastic, the concept of mudras and how it changes the various thought processes. how it affects your various organs, but we have now to generate evidence. And I'm sure the evidence is available. And in that term, I do not know how you're going to convert Patanjali Yoga Sutra into the conventional medicine. I'm not very sure that will be very easy, because while conventional medicine only takes into account the hard physical realities, the other systems of medicines does take into account, as in and Patanjali Yoga Sutra, various other ways of validating those types of evidences which are not so-called physical, but it does alter your systems in such a way that it can actually might be felt only through a much more internal realization. And how can we produce that? I still don't know. And I seek assistance.
Anakul, let's find how we can produce that. Stay around. We'll be back with you. Let's go to another expert. She's part of Healing Our Earth and Integrated Health as well. The Art of Winning. Rajiv, tell us more about Sarah and bring it on.
Yeah, so I think it's so interesting. I and Sarah have worked together for now several years, and I have found her very inspiring in the way that, and she's so flexible, so adaptable. And at times I feel that, look, she has got so much to give. And we have talked about this whole integration, because real life is that there are so many components of it. And I have been expert in the gastroenterology and nutrition from the medical field, qualified. She has done so much more in terms of mentoring, in terms of the nutrition. And I think she's very meek, very simple, but I found her very, very inspiring, a successful woman who has made it to the top through her own personal efforts. And she does live in the world of nutrition. She breathes nutrition, she talks nutrition, she eats nutrition. And she advises, and it's very, very useful. And I think it's good to see. And she believes, like many of us, that nutrition is an important element to it, and therefore healthy diet. And we do together a 30 days healthy living program, where we take people through one day each day on 30 days, and people learn the habits. And majority of you might know that if you do anything on a regular basis for 21 days, that becomes a habit. So learn to live healthy, learn to be happy, and learn to live longer through changing the habits. And Sarah, living example. Welcome to Healing Our Earth. She has been on us, but now, here you go, share.
Thank you, Raji. Thank you, Neil. Thank you, Amrata. Thank you, everybody. I absolutely love this forum. And I love the fact, that, the passion and the belief in everybody that's part of this for really changing the world. One person, one thought, one vibration at a time. And I know there's always amazing energy vibration on these calls, because we have got this combined belief and power, and also so much knowledge and expertise here. I'm overwhelmed by it all. Absolutely amazing. Thank you. And yeah, it's been a pleasure to know some of you over several years now. But I am a health and wellbeing mentor with over 15 years experience in, I call it holistic wellness. I've always been interested since a young person in all the different modalities that there are involving health and nutrition, whether that's Reiki or acupuncture or all the different things that we've got. But I'm passionate about really now in the work that I do in helping people understand the powerful connection between what we eat, how we think, and how we live. And this has already been alluded to by some of the other speakers here, because this is an extraordinary room of expertise. But I'm really here speaking to a bigger global market of people that may be out there listening across the World Wide Web, but just to inspire people to want to make those powerful changes that will help you feel amazing every day. And it seems really simple, and actually it is. It doesn't have to be complicated. We truly are what we eat, and what we eat affects everything. It affects our energy, our sleep, our stress levels, our immunity, our longevity. And by integrating the different modalities of medicine with a holistic nutrition and lifestyle habits, we can create a life that is honestly not just about surviving, but thriving. And our nutrition is fundamental to our wellness and the integrated medicine philosophy of that. And I feel really sad when I have many friends that have had many illnesses. And it's often only been when they've had quite a crucial diagnosis that they've decided to then think about the food they eat and cutting out things and bringing in other things. And actually, our body wants us to feel like that every day. We shouldn't wait till we're ill to want to start to feel better. We can continue. So what I want to share with you, just some very simple, it's a massive subject. So just some simple things over the next few minutes is based on my experience. It's based on my clients' experience. And it's based on being part of one of the world's leading healthy living movements that I've been part of for more than 45 years. Not me myself for 45 years, but the healthy living community I'm part of has been in the approach of helping people flourish with sustainable healthy living with products and programs and leadership support. And that's where I've learnt my knowledge from. So I have to say, if anyone has any existing conditions, please do consult with a medical professional. There are many of them here, by the way. Because my recommendations are not meant to cure or treat, but they are definitely helpful, healthy alternatives, which I know for sure, because I have seen firsthand myself, to help to boost optimal health. So I have personally been a vegetarian for over 35 years, and I've been solely plant-based for more than 10 years. And up until this stage, I am plus 60. I have enjoyed exceptional good health, and long may it continue. And ever since a small child, I was adverse to eating animal products. It was just naturally inside me that I didn't want to eat those. And so, when somebody else was saying, trust your intuition, trust what your gut's telling you, do it. If it doesn't feel good, if you're eating something that's making you feel tired or stressed out or unhealthy, then quit it. Your body wants to be healthy. I always advocate the 80-20 rule because, in short, that helps us to balance healthy lifestyle. 80% of the time, do the best you can. The other 20% of the time, you're probably going to fall off the wagon, and that's okay. But the exciting part is that our body can start reacting to better nutrition in just one day. That, putting in your body can start what you put in your body can start transforming your energy, your mood, and your focus immediately. And we know that to be true because if we eat something or drink something particularly that doesn't agree with us, we start to feel not so good straight away. So just going to run through some sort of key pillars that are really really passionate to me and to all the people that I've learned from. But everything, as so many people who are on this group here know now, everything in our body is connected. Our gut, our brain, our energy levels, our skin, which is obviously our largest organ. Nutrition is a cornerstone of integrated health. And a plant-based nutrition-dense diet can be a game changer for our vitality and our longevity. So firstly, really simple things that most people will have heard about now. But the gut-brain connection, obviously, we know that our gut acts as our second brain. Some people actually think it's even more than just a second brain. But more than 100 trillion microbes in our gut influence our digestion, our immunity, and our mood. And a balanced microbiome supports that mental clarity, and it supports emotional stability and a strong immune system. So we have to prioritize whole plant-based foods, which are packed with fiber, prebiotics, and obviously probiotics. And a lot of people say to me, well, what is that? So for anyone that isn't aware, that's listening into this call from somewhere, the prebiotics are that type of fiber that feed the beneficial bacteria in our gut, and that helps them grow and thrive. And they act as fuel for the probiotics, and that contributes to a healthier gut microbiome, which basically supports digestion, overall well-being. And just got a quick list of some top-based prebiotic foods, which are available right now to everyone at their local supermarket. Garlic, onions, leeks, asparagus, bananas, chicory root, flax seeds, oats. They all help with good bacteria in the gut, antioxidants, resistant starch, all of the things our body needs. And then probiotics are the live beneficial bacteria that add to the population of your healthy microbes in your gut. So they can help balance the gut flora and support the digestion. And those are things like sauerkraut, kimchi, tempeh, miso, kombucha and pickles, all these things which are fermented are packed with protein and probiotics for our good gut health. So just something as simple as that, looking at those vegetables and thinking, right, I need some of that and I need some of that. And then avoiding processed foods wherever possible, because they are packed full of additives that, guess what, disrupt our gut health. And then obviously to hydrate well, our body needs water to support our digestion. But then the second thing is to think of food as fuel and not just a filler. And so many people grab stuff to eat because it fills them up. But the food we eat is either fueling us or draining us. And we know that because we know how it makes us feel. And a nutrient-dense diet rich in vitamins, minerals, and antioxidants can and will transform your health. Eating a healthy, nutrition-dense, mainly plant-based diet by nature increases your energy and productivity. That's because nutrient-dense foods support your cell function and therefore reduce inflammation, and that keeps you energized throughout the day. So if we can eliminate foods, you can go out and find out all about this. I can't, this is just a quick 10 minutes, but if you can eliminate foods that cause inflammation and sluggishness, which could be from refined sugars, processed foods, meat and dairy, and incorporate whole grains, legumes, fruits, vegetables, and then balance your blood sugar by eating regularly and choosing whole foods over quick processed snacks. And that can really supercharge your diet daily, you know, with really powerful anti-inflammatory foods. Like every day I include turmeric, cinnamon. That can be sprinkled on anything. It can be sprinkled in your smoothie or your shake, in your coffee, in your tea, flax seeds, and even just one, I don't know if you know this, but even one Brazil nut a week has been proven, right? Not by Sarah Mills. Scientific papers have been written on it, has been proven to lower your cholesterol, one Brazil nut a week. And these superfoods are rich in antioxidants. They reduce inflammation and they support lung, heart, and brain health, some of which in those are the biggest disease killers known to humans. And they also play a vital role in keeping our arteries unblocked, lowering our cholesterol, and boosting our overall vitality. So if you include things like whole nutritious beans, of which there are many types of beans, berries and all fruit, cruciferous vegetables like broccoli and cabbage and cauliflower, and greens, and a huge variety of other vegetables, flax seeds and linseeds and nuts and seeds and herbs and spices and whole grains, and obviously drink plenty of water and healthy drinks. This is it's a wonderful daily dozen of things to think about. And that daily dozen is taken from Dr. Michael Greger, How Not to Die book and cookbook, which I highly recommend. And he is referencing there hundreds of research papers on the foods that we eat and the effects of our body and disease and prevention. And honestly, you'll be well on your way to a very happy, smiling, healthy body inside and out. And then lastly, that kind of mindset and energy, which is our secret superpower. What you think and how you manage stress has a direct impact on your body, as we've already heard here today from some other amazing speakers. And a positive mindset fuels success in both health and life. So we have to be mindful of our thoughts and our environment, what you watch, what you read, who you spend time with, how that influences your energy, and how you're going to find your 6 to 8 hours of good sleep a day. And doing a little bit of movement every day. Exercise isn't just about weight, it's about mental clarity and reducing stress and enhancing our overall health. So it's just some really simple winning formulas, simple steps for a healthy life. Making changes does not have to be overwhelming, which is why I share about this in a 30 Days to Healthy Living program. But 3 simple steps that anybody can start today is, it does take at least 21 days to form a new habit, and it takes at least 90 days for it to become automatic. So think about that. You've got to just push through with it. If it feels good, keep doing it. Don't stop. But start by swapping one unhealthy food for your nutrient-rich option every day, and maybe keep a food journal to check your progress and see how you feel. And then secondly is obviously to surround yourself with like-minded people, find a community that values your health and join those communities like this amazing integrated health global platform we've got. And then thirdly, tune into your body. If you're constantly tired and sluggish or unwell, your body is telling you something. So trust your body's wisdom. It knows how to thrive and it knows how to give you the right fuel and the right power, because your body is designed for vitality, energy, and longevity. And by making those mindful food choices, managing stress, and surrounding yourself with positive influences, you will set yourselves up for lifelong wellness. You really will. And so I invite you to honestly take this seriously, but do it in a way that's fun and empowering, and it's totally achievable for everyone. And, you know, I share those in guidelines with nutrition that supercharges you, in a community that like this, that, you know, uplifts you, and make that happen. You know, there are some wonderful proven systems that can really help you to support better nutrition, better gut health, mind health, enhanced energy, and better sleep. And that balance of your weight as well, so that your body's in flow with how you should be for your body and your type. And so many of these principles are based on the Ayurvedic principles of the mind and body balance. And our health is our wealth, and what we eat is the simple yet magic ingredient to how we feel, think, and ultimately thrive. So thank you so much.
Thank you, Sarah. Rajiv,
Yeah.
Sarah has mentioned very simple thing here. Do it in a fun way. Experiment what fits and works for you. You don't have to be crazy. And simple stuff. She mentioned cinnamon, turmeric. Ananda proposed a bit of yoga. Dr. Sunny said that, look, go for it. Elaine is an example how she took her life, her control. Stage 4. I mean, stage 4 is almost saying, okay, thank you, you're written off. God has organized a space for you there. And Elaine said, fine, thank you. I'm going to go anywhere. Well, I'm going to live the best of the life. So, Rajiv, let's do something. Let's go around with each person and we'll go to the USA leg in a moment. If we take a comment of minute or two from everybody who is present here, Manisha, Dr. Abdul, Dr. Sunny, Anukul, Danada is here, our Vedamela, Sharon is here, Amrita is here. Let's take a minute or two comment on overall from what Sarah said and how the earlier contributors all integrated various methods that they brought in. So let's start. Elaine, you are a very fine example of how you controlled your own life. You managed it, including kidney problems and stage 4. And I think it was, if I remember, Hodgkin's lymphoma, which is fairly common, and non-Hodgkin's is still they're discovering few malignant cancer stages as well. So Elaine, how do you resonate with all what others have said together with yours and what Sarah have said? Over to you, Elaine.
So I think we're all talking the same language, aren't we? We're all on the same page. And it doesn't matter what qualifications anybody has, how old anybody is, what country they're from, we're all talking the same page. And that's really important, Sarah was saying about Jim Rohn, I think it was, the late great Jim Rohn. He said, look at the 5 people around you, and the 5 people around you, if they uplift you, keep them on. If they make you feel bad, they're not your people, then walk away from them, divorce them. It could be partners, it could be work colleagues, it could be anybody, friends, family, it doesn't matter. And I've helped lots of people to reverse stage 4 cancer and other horrible things as well over the years. And it's the emotional side of things that always gets in the way. People tend to do things to please other people. And if you're a people pleaser, you're not necessarily going to heal terribly well. I used to give talks to audiences when I was in the UK. I'm in Portugal now. And I would be able to look around the room and know instinctively from the behaviour of people who's going to heal quickly and who's going to struggle, if at all. Obviously, I had to choose my words carefully when I was speaking live in that situation, but it's not rocket science. Just
So
believe.
Elaine, let's summarize your tip. Elaine is saying, don't suffer in silence. Don't impress others just because you need to be friends with them or in relationship. Don't stay around any negative energy. Walk away. Love yourself. Heal yourself first before you please others. Elaine, thank you very much.
Yes, thank
You have
you.
lived the talk as well. So that's beautiful. Let's move over to Dr. Sunny. Dr. Sunny, you resonated with this and you were very clear. You started with using the word complementary and said, hello, no, I want it to be integrated health because it is required. It is not an option that, hey, look, side dish. So what do you think, Dr. Sunny, after having listened to everybody who are in line with your thinking too, Dr. Sunny?
Well, I think it's yeah, some of you don't know that I actually sing. It is a long way to go. It's a long. So it's quite interesting with what we're discussing here today. A very small group with a lot of potential profundity in terms of health and wellness. I think for any healthcare professional, their aim is to focus on their client or patient, as you the way. If you are able to save one life, it's a one life so many that bring you a lot of joy. No money can buy that. The initiative now that Dr. Gupta has brought about with all of it within the ecosystem, I think it's something that we all need to support. And this meeting should be a regular platform for education. It has been absolutely amazing. But one thing I wanted to just emphatically mention here is that how do we want to move as a community, as the initial stakeholders, how do we want to move this information forward? How do we want to influence people? And what real core rigidity, what real core product is the integrative platform going to be providing to practitioners? And what are the skill of these people? Platform like this, we all learn. Whether you're a medical doctor or you are a non-doctor, we're all learning all the time. I mean, I picked up quite a lot of information today, which I'm going to take back into my practice. It's been very useful. It's been very eye-opening. So my recommendation from here today is, let's see when we're going to have another meeting and how many people are going to be there. In future, we're going to have face-to-face in terms of what it is. Bring on board a lot of practitioners with your connection, with my connection. We'll bring them on board. And it becomes a subscribed system where people will pay, I don't know, £50, £100, 200 a year to become a member and advocate of this particular platform, because it's going to save, I'm telling you, going to save so many people. And all of us here, we have gone into a lot of practices that we've seen that the traditional way of looking after patients is very frustrating. And we have so many doctors who are so frustrated, even some of them even take their own lives. I was in a medical conference about 3 weeks ago. This doctor was just at the point of taking his own life because he just cannot see the benefit of what he's doing. He's working against his own interest for what he has been trained for, right? So a stitch in time saves nine. So let's see how many people we can save with this particular information, because information is powerful. And that's the only thing that can bring this all about. So
Dr.
you have a lot
Sunny,
of hard work, Dr. Gupta, with what you put together. But like next time, I'm going to make sure that Chinese are going to be here as well, so that it really become integrated. And I call it the balanced healthcare ecosystem approach.
so Dr. Sunny, just for your information, this is a Healing Our Earth platform, which is a free community online channel
Very
that
good.
transmits into different countries at a consumer level. So Chinese people, you'll meet the Tai Chi, Qigong, and all the alternative people on 23rd of this month. On
Okay.
Healing Our Earth is all different people on different parts of the earth. Rajiv
Okay.
will keep you in touch with Kit Sharp, who is doing that with Sharon and Rajiv. So we bring all different kind of sessions, and you hit the nail on the head. The time is right now.
Yep.
Where do we go from here? So Rajiv will tell you about a later part of the year where in-person conference will take place, where people can actually bring the ideas together. And as you say, a common platform or an association that can subscribe to, people can subscribe to and get alternative help. When we always get to, we get 3 or 4 quotes when we want to change tire and engine and a car and an insurance. Let's do that for our body, because we change the car tires, but we don't change our footwear, do we? That regularly. So our body also needs care. So Dr. Sunny, what's this space on 23rd of February at Healing Our Earth is all Tai Chi, Qigong, and Tai Chi and Qigong and Chinese related matters, which is coming. Thank you very much. And Rajiv, there you are. Dr. Sunny has pledged his help over here that let's carry on and we move the step forward in bringing this to the world. So that's fantastic from Sunny. Rajiv, let's take a comment from Manisha. Manisha, your quick comment so far before we move on to the USA leg, where our USA team is waiting. Manisha, what have you learned today, and what is one tip that you want to leave with people? Over to you, Manisha.
Yes, thank you. I have seen all learned panelists sharing their knowledge, and I would like to suggest only one thing here. Everyone was able to share all their positive things, what they have experienced or what their patients have experienced, only because of one thing, and that is documentation. They documented what happened with their patients. They documented how the drug responded to their patients. They documented the safety of that particular drug or that particular behavior or particular habit or dietary and lifestyle changes, what took place. And that's why they were able to achieve these conclusions and fantastic results. So my emphasis would be on documentation, because I have a small story to share here. Just 2 minutes, I won't take more of your time. While I was doing the April trial, which was using ashwagandha to treat long COVID patients. So our plan was to just enroll patients and then prescribe ashwagandha through post and ask them to follow instructions over a phone call. But because, everyone here will be surprised and shocked to know that we were not able, in spite of having Indian Ministry of Ayush in support with us, because the study was in collaboration with Ministry of Ayush, we were not able to produce ashwagandha safety data to the MHRA. And because we were not able to produce safety data, in spite of ashwagandha being used for decades, for generations, for years, centuries, and with evidence that ashwagandha could cause hepatobiliary dysfunction or some other problems, MHRA asked us to conduct this trial through GP practices so that patients can be monitored. So this is what we need to encourage and emphasize on documentation. And that's why the integrated system here, what we proposed, is going to have emphasis and a standardized model to have examination and the entire process document and standardize, so that we are coming up with more and more evidence-based practice. And what I saw with April is NHS doctors are keen. My own GP is keen to include integrated medicine, because at the end of the day, all doctors want their patients to get better. But if we improve our communication skills, if we encourage them, or if we improve our language, and we make them understand in the modern medical language, probably they'll be more keen to embrace us and to go hand in hand ahead to make a better world.
Thank you, Manisha. You hit the nail on the head there. Let us bring more documentation. And three of the people who will not be surprised with what you say are all from Ayurveda background. Dr. Dhanada Kulkarni in Texas in America, and Dr. Amrita Sharma in Jalandhar in India. Both of them agree with what you say, and they're working towards producing data, as is Professor Rajiv. He is very keen because being part of NHS, he knows how to present, and he started several years back and also practices Ayurveda, yoga, and is a medical doctor. So it is very true. And Dhanada, your comment on what Manisha said, you agree with her that we need more data. Is that right?
Absolutely. More, thank you. Global namaste to everyone, first of all, and very happy morning from the Dallas, Texas. And I totally resonate with what Dr. Manisha is saying here because integrative medicine is the need of the future medicine. We are emphasizing in this era about the holistic, patient centered approach, which not only treats the diseases but focuses on prevention, lifestyle, and mind body balance. And what Dr. Manisha is saying is bridging the modern technology to the traditional healing is the key to go alongside with the pharmaceuticals, big pharmaceuticals that they're competing, and making the personalized medicine is going to be the future medicine. I believe that Ayurveda's preventive care, like what she was mentioning, often look very negligible to document into diet, stress management, lifestyle modifications. But if Ayurveda given the first line of treatment in Ayurvedic concepts to incorporate dinacharyas, the daily routines, and ritucharyas, the seasonal regime, which will help an individual in long-term well-being. And then we come to personalized medicine, which is utilize a genome medicine science and diagnostics tailored on that, which we call as a prakriti based, and combines the AI driven healthcare system with the from this ancient wisdom to a customized wellness roadmap, and show to the world that with the proper documentation, it's possible to do the sustainable lifestyle plant based remedies can help people to maintain their lifestyle. And definitely today's topic about the integrative, there's so much we talked about the yoga, meditation, mudras, pranayam, obviously play a very integrated and very important role in managing stress and chronic diseases. So people often do when they have a sedentary lifestyle, or often they are very tired lifestyle where they feel like I am aging faster than what I was before. That is raising this global acceptance is a WHO what right now doing is asking more evidence-based studies, documentation to the healing systems like TCM and modern medicine and functional medicines. These are all becoming the good norms in this era right now. So definitely I would pass on to Amrita, who is also integrating more mind body therapies at the bigger level in the Mandi, IIT Mandi. And over to you, Amrita, to comment yourself there. Thank you.
Thank you, Dr. Dhanada. Yes, I had been listening to what Manisha ji has said, and I can very well understand when you are into one particular system of trend and then coming out of it, and when the same traditional medicine system is facing up the global challenges, because when you are at your place at that time you don't realize, but when it comes to globalization of a particular thing, there where the challenges come, because there the policies, the norms, and the authentication criteria has become very different. Coming up to Ayurveda, when we talk about these kind of things where ashwagandha's validation has to be required, where in Ayurveda we say, because it is a time-tested things, what traditional healers have been doing is a time-tested thing, and something that we take it as an aptopdesh praman, in which they have already righteously said, as we follow the Vedic scriptures, as we follow up the Puranas, as well as we follow the Upanishads with the blind eye. But when it comes to certain protocols, there has to be a standardized protocols that have to be followed under the criteria where they lie. And that's where it's very important to amalgamate all the systems together and to synchronize them with other interdisciplinary systems, which are, as I mentioned before, the biotechnology, as well as bioinformatics, as well as the quantum theories, because that's where the vision starts from now. And to match with the race of today, it's very important to meet that end of the West to the end of the East in this way, and that's where the validation will start. A lot of things have been done. Thank you so much.
Dr. Amrita, your point again, matching with Dhanada and Manisha. So let us help the institutions of different countries like United Kingdom, USA, East Africa, who is slightly advanced now, and Mauritius, which has actually taken Ayurveda in the government and the institution. There, the data have got improved and they're doing very well. And we know the Healing Our Earth people are actually part of that. Now let's bring a better data, more information, so we can convince the authority on a safety and an insurable risks of the products and the method and the system, which Rajiv in his own way is also propagating. So maybe within 8 months, you will see a questionnaire from Dr. Rajiv Gupta coming in a systematic format, which will be presented in a correct way that we can actually present the data. So it's going to be fun. Stay around. We want to take more comments and we want to expand on that. Manisha, keep in touch with Amrita and Dhanada. Rajiv will loop you in there, and they are from your field, quite senior, so you will enjoy talking to them. Sunny, you wanted a bit of Chinese, so Sharon is going to shift her talk into a basic Qigong practice, okay? Just for you, Sunny. She has come and she is going to talk a bit about that. And remember, Sunny, on 23rd of February, Rajiv will keep you in touch with that. It's all Tai Chi, Qigong, and Chinese medicine episode, because that's what we do at Healing Our Earth. At Healing Our Earth, there are no exams, no caste, no creed, no gender bias, no politics, simply good information, which is the art of winning. You know, Sarah might be smiling about it because she likes the art of winning. So that's very beautiful. Let's go to Anakul. And then we want also Rajiv to make comment. Anakul is now, Amrita, while we got these people over here, let's bring more integrated, the mind, body, consciousness as well. And we remind them what is going to happen at the IIT. Just tell us a bit more about this, Amrita. So if those who are interested, they can take part in it.
Thank you, Neil Kumar, and thank you, Healing Our Earth, for supporting this conference. So on 4th to 7th of June 2025, there is an second international conference on mind, brain and consciousness at Indian Institute of Technology at Himachal Pradesh, which is organized by my department, Indian Knowledge System of Mental Health Applications, ICSHMA. And we call for the papers as well as various special sessions on different themes of science of consciousness, neuroscience, mind and brain, theory of perceptions, quantum perceptions, cognitive psychologies, biomarkers, wearable devices for IKS, sleep and dream studies. We touch on Indian philosophy, as well as Ayurveda, mental health, performing arts, music therapies, IKS personality traits, as well as a lot of sensing technologies. And we invite neuroscientists, physicists, biologists, Ayurveda practitioners, yoga meditational practitioners, computer scientists to join in for this. And the registration fees is for the students is 3,000 INR, which is rupees, or 150 USD and 300 USD for faculty. So now, you can log into https ixma.iitmandi@ac.in. Yes, please.
Amrita, while the submission for the paper is gone, we encourage
it's extended to 15th of February.
If you have still got a paper that you think will be very good,
Yes.
Submit it, because as an ex gratia, they will still look at it till 15th of February. So you haven't missed out. We have requested an extension because few people want to present it. It's very good. Amrita is directly related over here. So, you can just contact. If those who know Rajiv can go to that, those who know Sharon, those who know Danada, or if you don't know anybody, just come to Healing Our Earth. You'll come to myself. So this is going to be very exciting, and they've covered almost every specter of life. So that's the beautiful part. And again, Sunny, as you said, not complementary anymore. This is integrated mind, body, and consciousness. After the COVID, we have started respecting our mind as well. We have started respecting our relatives. We have started respecting that, hey, sometimes the medical world cannot always help. There is something beyond that, and we have realized that. So that's very useful. So, Anakul, let's come to your points. Not only are you a very senior orthopedic surgeon, but you also give rulings to the NHS for any legal matters, and you love and your affinity to India and Vedic knowledge and the Asian scriptures of India, and you like this conference as well. Your comment combining everything that we have done today. Over to you, Anakul, for next 2 minutes.
I think it has been an amazing, amazing meeting. Every little word that I heard from everyone, I was connecting myself to it, and it is a lovely association of people. I also wanted to thank Dr. Gupta particularly, Professor Gupta particularly, because we had a long discussion as to how to make our system work in such a way that we are able to integrate the system in a language which is understandable to the modern medicine. And it is not an easy process, but our language is different. And I must say that there is a certain element of, must I say the word, an element of prejudice. Many of the people tend to simply ignore what is otherwise logical. And not to be able to hear what the patients are saying is something has become quite common, because it is not unnatural for us to sitting in the clinic, some patients giving some complaints and then say, well, that comes into that category, and put it in the basket and let us heal that basket, rather than trying to see the person as a whole. And that's where the need to get a holistic medicine is very, very important. I particularly would like to say that I do have, obviously, I did talk to Dr. Amrita Sharma as well about a paper that I will be presenting over there in that meeting. Same thing, I've also offered and extended my, this thing to Professor Gupta. Maybe I can make his presentation as well. I'm no good in, I've not worked in them, but I know how I would like to sort of put the things across, and I'll possibly learn how to make the presentations good that is acceptable to all. Finally, I think I would like to, every person who has given sentences over here have a set of sentences which I would like to just collect and make a paper of its own to say that these are the difficulties we face, because we speak a different language, we speak a different way, and that should be something that should be encoded, and everybody should be able to add to those comments. And that will particularly add in supporting some people who have used certain other methods of treating the patients in a clinic, but they land up in a legal problem. And then the patient says, no, I was advised by the doctor to do it like this. And one doctor to do it like this, another doctor told me to do it differently. And then what should I follow? Things did not go right. So it must be the other fellow's mistake who gave me some other advice and not this doctor's. These are some of the issues that we will have to handle. And that is where I think we'll need the support of this kind of group to say that we agree that this method of treatment is reasonable, but yes, something else could have gone wrong. We do not know what is what. And that is where I use the word quantum entanglement. We have in our system, one particular drug will have one effect, but the holistic system has everything action that you take affects everything else. So let us not take just one thing at a time. I think that is my little.
Thank you, Anakul. Anakul believes in this so much that he wants to go to Himachal Pradesh. He wants to go in. What a wonderful place it is. Amrita will be there for those who want to go there or want to know. Or if you are not able to go, but want to know more about it, contact our chief admin at Healing Our Earth, Dr. Amrita Sharma, and she can furnish you with more information for that. Sharon, get ready for your basic Qigong knowledge and everything. We come back to you in 3 minutes. Let's go to Rajiv Gupta, who has been there before 2 o'clock, our episode producer here as well, and has made sterling efforts for those of you who are interested in the integrated health in-person meeting, which will be later part of this year and regularly from next year onwards. Contact Dr. Rajiv Gupta. If you don't have direct access, doesn't matter. Anybody you know over here knows Rajiv. Rajiv, today, mix of people, everybody agrees that integrated health is also required in people's life, body, mind, and consciousness. Over to you, Rajiv. What would you like to summarize before we go to Sharon and Danada, who is going to bring a different flavor to us?
Thank you for that, Neil. I think it has been an amazing day. There has been not a single minute where there was lack of energy. It's full of energy, new ideas, new people. We have populated the whole system, and now is the time, which is repeated time and time and again. New era of health system has begun. A system that is compassionate, holistic, and sustainable. It does not disregard any other system, but pulling everything together to devise the integrated healthcare system, which is an ecosystem designing to begin the legacy of a new era, and a mastermind group which have worked on it for past several months in order to culminate today, which has captured the thoughts, and it's just in some way spreading across. So the way it has performed today of a group of people, many who are ambassadors or proponents or supporters, it's all the part of the community that is the baseline. And nobody has diverged from the ecosystem connecting these together. Currently, each of them are working in parallel lines, but they all need to work as a hub and spoke model. And there is no one science which is smaller than the other science. All of them are equal, and all of them treat or heal in some way or the other. And if you can combine, the power is immense. And we have seen it today, all of that, the science which Manisha has brought together, the system which we have heard from Sunny, Dr. Bhushan Patwardhan, who is a stalwart in himself, has initially talked about, and how he and I have talked together, we heard together how Om to Genome works, and how integration of yoga and Ayurveda about the book that I have written is going to be the future. But then there is other sciences as well, which we talked about as the acupuncture, acupressure, Tai Chi, Qigong, which is the other part, and I have been heavily involved. And I have been, Sharon might know, awarded in the World Tai Chi and Qigong or World Health Congress last year. No, sorry, 2023, not last year. The 2024 is last year now. And it is just in recognition of the contribution, in recognition of the hard work. But I think there is a lot more people who are doing the same work. There are a lot of people who are doing bits and bobs. The idea is to conglomerate our knowledge, conglomerate our thinking. And we know that not one person can do it. It's a mammoth task. We are against big giants. And now time has begun. You probably haven't heard, we had a very young guy called Abista, his vision, his thinking on how he thinks that future generation needs to have it as essential for changing the life. This novel system is going to work. And then we have done quite a few of these episodes, but each time there is more and more richness in it. And we will have, we have done a survey with University of Birmingham earlier that is specifically on awareness of the NHS employees, doctors, nurses, and other healthcare professionals, which we are going to publish. regarding Ayurveda, but then there are other parts as well. So we're going to have a common platform, which is to bring the complex cases in order to help, because we are all here to help the humanity, to help healing people who are suffering. And then later part of the year, as you mentioned, that we're going to have a whole day conference where we will have different sectors and bring them together, how these work together, because we have got a single spine. So the word important today is we are a single spine. And now there are different spokes which are connected to it, so that if the spine is strong, it will sustain all other disciplines. And these disciplines could be yoga, Ayurveda, acupuncture, acupressure, Tai Chi, Qigong, aromatherapy, music therapy, dance therapy, hypnotherapy, all of these together combined into this integrated system. Let's make it happen in 2025. Thank you so much. All the contributors, all the speakers, all the listeners, all the viewers, all are to be congratulated for being part of it. And for the organizing team, back-end team supporting it, let's give a big round of applause to everyone. Thank you.
And Rajiv is still not finished because we are still getting out for next half an hour.
Exactly.
The next
Now we bring the
Integrated Health episode is on 23rd of March. And for those who are connected to us, it is not just health we cover. We cover any subject, every subject that is generally common and good for humanity. So just to quickly tell you, next week is Valentine's special. If you know a poem or a song, Dr. Sunny, you sing, so you must come and sing as well. Or if you got a love, romance story, just come, let us share. If anybody wants to propose, they can do it live on Healing Our Earth. Let the world know that is beautiful. Sunny, this is the one for you, Tai Chi and Qigong.
Dr. Gupta, if Sarah is going to be there, then I'll be there.
Yes, and a lot of people will be there. You'll meet so many people from different countries, and the theme is Harmony of Asian Health Cultures. So that is Sunday, 23rd February, and yoga and meditation for body, mind, and soul on 2nd March. Every week we bring different theme. International Women's Day, we have a Glow Forum, a huge section in Healing Our Earth. So this is for International Women's Day, and then the World Kidney Day, so on and so forth. So if you want to know more, visit the website, which is very simple, healingourEarth.com. Go to the future sessions or a past session. You can see all the episodes. Each recording is kept there. And for next week on Valentine time, if you want to spread the message of love, romance, unity, peace, harmony, just pop in, and it's open for all. At Healing Our Earth, no race, no caste, no creed, no gender bias, just open for everybody. And now let's welcome our Sharon, our senior host from United States. Sharon had a wonderful trip very recently with salt suction, so she's going to tell us about that. Sharon, of course, is a multifaceted artist and an educator. She's a very good documentary filmmaker as well, and an author, a composer, choreographer, and a master teacher in a world dance. And you will see it very soon, what a production that will be coming. And, you know, she loves music, traditional body technologies, and somatic science too. And her, Sharon's groundbreaking Quantum She, along with numerous other documentaries, have been so famous that includes Asian cultures, healing, art, yoga, alchemy. Testament is of her expertise as a president of the Sacred Mysteries, and this episode is broadcast live on the Sacred Mysteries YouTube as well. So we go through so many channels. She was also the part of the 20th World Congress, Tai Chi and Qigong. We actually held the World Congress Day on Healing Our Earth here live, where we had lots and lots of people. Global Summit she's part of. There is so much more to our Sharon Rose. Ladies and gentlemen, bring it on. Sharon Rose, Danada, tell us for the next 15 minutes, what have you got lined up for us before we wind up? Over to you, Sharon. Welcome.
Welcome,
Global Namaste, everybody. I'm a little overwhelmed today because I had a 6-hour interview with our dear Hitendra Rana. on Soul Satsang yesterday, 6 hours. It was like my entire life. And if you want to see any video of my dance career, etc., just go to his channel, Soul Satsang, and you will see my life unfold in front of your eyes. What a wonderful interviewer he was, and his team of young Indian men and women was fantastic. I really appreciated them. You know, we learn all of these things, especially those of us in the traditional arts. And to have at this age, to have these young people so excited and so inspired and asking such deep questions was so enlivening for me. So
And the beautiful part,
Yeah.
Sharon, the beautiful part is not only has he visited you there in Creston, the beautiful mountainous region of Colorado, as has Dr. Vedacharya, Dr. Dhanada Kulkarni. So Healing Our Earth people from different states have started meeting in person now. And quite a few of them were recently in Mumbai, Ahmedabad. You saw in the group messages, some who is a movie making. They're all part of Healing Our Earth, united together to bring this beautiful thing. So if you got any project or ideas, or you want to be connected to any country, just come to Healing Our Earth and we'll connect you. And Sharon, marathon session, I mean, 6 hours is a lot of time. We saw a glimpse of it and we put that up in the social media as well. So we want the more links and everybody can even watch more and better.
So I have another great news to share with everyone. Since you mentioned, Neilji, about connecting with each other, and Sharon is going to be the presenter at the Global Traditional Conference happening in March in Houston. And that is with the Cassandra Wellness Group, which is arranging a 3-day conference for acupuncture, TCM practitioners, Qigong healers, and Tai Chi healers. And we have got the green signal from them to have Sharon's team and Sharon come in person, teach us the conference about the Qigong practices, and also to showcase her documentary film, which is going to be really awesome. And congratulations to Sharon. We made it.
And Dhanada, for the people who don't know about Cassandra, they are an accredited institution. So Sharon, you are not just going to a private institution, you're going to an accredited place where our Dhanada has got a good relationship. So Dhanada, we are very proud that again, you know, the healing people are actually assisting each other, and wherever they can, they plug. Because at Healing Our Earth, it's not just mine and me and I. It is us. How can we enhance us, each other? And that's the beautiful part. Dhanada, who is in Texas, and Sharon, who is in Colorado, completely different state, different region, have created such a good bond over there. So Sharon, well done. And we are very proud of you because you carry a lot of wisdom, and Dhanada carries lots and lots of energy. So isn't it wonderful?
And wisdom. She's amazing. And she's, you know, there are a number of us that we don't just look into one area, one little box. We look into the vast field and learn and take tools from all of these different traditions. And Dhanada's doing that as well. Not only Ayurveda, she's really now training in traditional Chinese medicine. And that's really what's so beautiful also about Healing Our Earth.
So Sharon,
together the world.
Sharon, Dr. Sunny was just mentioning, unknown to him, that Healing Our Earth, we take not just Chinese and Japanese, and you know, we Japanese people. So don't be surprised if you see Sunny landing up in Colorado or Texas. Okay,
we would love that. Please come to our
Rajiv,
of the Rockies.
Rajiv, can you make sure that Sunny is again connected, or maybe just connect to Amrita? And Amrita can loop everybody in, because Sunny, that's what we do at Healing Our Earth. We make global just one place, one family.
He has started having a Chinese uniform now. And, he will be ready on that day.
Dr. Gupta, there is a lot of potential actually happening here. You just cannot imagine. B2B strategy I'm already working out a lot of things. Then we can discuss this. Going into global organizations that are already in the field of integrative intervention. So this is going to be great, inviting a lot of speakers to come from various fields in the medical field itself. Within the system, if they're able to support and append what we're doing, then we're on the road of, big thing here. So big, you just cannot imagine.
Absolutely. And Sunny, what is that line of the verse of "We are on the road singing"? Go on, let's listen to the one verse of it.
Yep. Next
Go for it.
time, the next one we're going to be doing, I will invite one of the medical doctors who work with the Bath University on integrative intervention. So you can imagine. And that was one of the products I just mentioned, seeing the interventional part of this particular product. It's not doing marketing or anything. No, something that has helped millions of clients around the globe dealing with cell biology. That's what it's all about. And these are the doctors who are part of the research group. And I will get hold of him. He can come and do a presentation. He will become a member. And the organization itself, they will even subscribe to be a member because we can be part of their research group in the process. Isn't that incredible?
Amazing. It's amazing. So let's get him, as we talked last time. And the University of Bath is actually there, kind of doing something similar. So let's just join hands.
Yes, absolutely.
International organization doing this, and a lot of resources got into it. Let's just kind of bring them together and have the membership drive, as you are one of the important person doing that drive. So
incredible.
So it's beautiful. So let's connect each other. Amrita, if you can make sure that everybody's looped together, please kindly create a private groups, and then we can all meet up later, because this is not just integration of integrated health, it's an integration of mind, body, and soul as well. So it's so beautiful. Let's move on, Sharon. And there are a couple of questions here. Rajiv, there is one question for you. They loved when you summarized. So they want a tip from you that how do you control your mind over matter? I don't know what they are referring to. And this comes from South Africa. And it's Ruxana from South Africa saying that from what you were summarizing, how do you control mind over matter? I suppose he's talking about signals coming from brains, which is part of a mind anyway. And how can we make mind stronger than the physical condition that you are experiencing? One tip, Rajiv.
correct. So I have spent a lot of time into, it's called neuro-linguistic programming. So you can program your mind, and that actually controls all the body part. As you know, that people do 80%, 90%, 95% of the things without being aware of it. And this is the instrument that controls it all. So if you ask the right questions, you get the right answers. And there's a whole system. I'm a practitioner and master practitioner of NLP, the neuro-linguistic programming. And Tony Robbins is the master coach. And I've worked with him and his chief crew. So in simple way, one thing, a tip for people who are interested to learn, maybe we can talk in a little bit more detail, is that whatever you want to do, write on a piece of paper. So it's out from here to here, but more importantly, what you feed your mind in. So before sleeping, write what you want to achieve the next 24 hours, next day. And then read it next morning when you wake up. Just one single small tip. If you do it consistently for a period of a month, at least 21 days, I suggest 1 month, because no matter how good we are, we will probably have 1 or 2 slips. If you do it consistently, come and tell me how much change it has done. Your life will
Can
be.
I add as well for a second for this?
Yes, Danada, just before you do, Ruxana, I hope you got that. Start putting it on the paper, do it for a month or so and see if it helps you. And we now go to Danada in USA, who might give alternative tip. Danada, your tip for Ruxana, please.
So I just want to echo what Dr. Rajiv said. He comes from a background where practical and evidence-based noting is what studies he is doing. But I come from a spiritual and a lot ancient background. And in Bhagavad Gita, Arjun asks same question to Krishna. You are asking to win the mind, but it is such a hard that it is almost like you catching the wind in the hand. How can I achieve the control over my mind? And the same what Dr. Rajiv said, doing it constantly. So the next shloka, the verse Shri Krishna says, Abhyasena tu kaunteya. So you have to do abhyas. Abhyas is a definitely a thing that you need to do is to manifest every day what you look for, what you want for. Not only so there are types of manifestation. The one of the very powerful what Dr. Rajiv said is writing, because first is just imagination, then you speak out loud for it, then you come to the writing, and the middle one is visualization. So there is a para pashyanti vaikhari kind of all meditative plans on the mind. But the last one, what he said, is very effective because you are not only visualizing, but you are also writing. And that writing makes your every cell as a biogeome in your body to facilitate that idea that how you want to do that. It's not called just the control of the mind, it's also called facilitating or opening the new doors for the mind. Thank you so much.
Wow, so wonderful. Look, we've got 2 tips here. Ruxana, my tips is very simple for you. If you want your mind to be functioning, then remove any vengeance, anger, revenge, and hurt. Once you throw this away, then you apply what the tips have been given, and you will find that it will work. And the choice is yours. When you wake up in the morning, you decide you want it to be beautiful or lousy. Manifestation, where Acharya Dhanada said, manifest positively. If you want to be beautiful day, then say that you are going to make it happen. So if you feel cold and you give a signal that you are cold, you'll start shivering. But if you know that it's cold and you tell your body, hey, I can sustain that, your body can take over and you can find any environment. So Ruxana, we hope that you're feeling good at healing our earth. And Sharon is not going to go without giving her tips. So Sharon, you've got a tip as well. Over to you, Sharon.
I've looked at what we might call mind training from many, many different traditions. And I just want to give a few tips. For my own experience, what's helped me. One is when my mind is spinning, we'll say
Wavering,
that,
yes.
or when I'm in pain, I will use mantras actually, and start repeating. In the Tibetan tradition, we have one that's 100 syllables, and it's a for this deity Vajrasattva, the healer. And you imagine him sitting in union on your head, and then this long mantra, you imagine that this amrit, this nectar of healing, is flowing through your whole body. And it's so long that by the time you finish the 100 syllables, your mind is clear. That's one thing. But Qigong itself has tremendous amount of practices because it's such a self-healing technique to bring your consciousness into your organs or into the tissues or into the place that it hurts, and be able to work with the qi and your mind together to alleviate that pain. So I would advise looking into Qigong because it's helped me tremendously to become, I mean, I've been a dancer, but there's now a fluidity because I'm working with the qi and I feel the qi and I see the qi. So that's my comment on that, or a little bit of it. But the Dzogchen tradition and the Tibetan Buddhist tradition really have a lot of teachings as well. on the nature of the mind and how to work with the mind and the emotions. And one thing I've been talking to and looking at myself has to do with holding patterns in the body that are related to negative thoughts and fear. And so if you're feeling fear, then also remember you have a physical body, and feel into that body if you're feeling the fear, and what is it doing to your body? Where are you? Clearly fear will contract you. Where are you being contracted? What part of your body? Is it in your solar plexus? Is it your shoulders? And then become aware of the relationship with the thought and the physical, and then release the physical, and the thought will release as well.
So there you are. You got three different views in a different way. Well, talking about mind, body, and consciousness, Sharon, we can't leave out Amrita and Anukul because both of them are actually practicing mind, body, and consciousness. So, Amrita, what would be your take for a wavering mind, or for a people who can have a stable mind, or maybe control their ailments or their fear or their anger or anything through mind? What tips would you give?
I align very well with Dr. Dhanada and what is written in Bhagavad Gita, as well as Sharon, because practice makes the mind perfect. And the most important thing is, whenever your mind is wavering, it's very important to have self-retrospection, where you discover yourself in a way of self-questioning what wavers your mind. And in that, a lot of things help you. Working on your hobbies, something that you like, will always help you in calming your mind. And once your mind will be calm, it will always gives you answer of a lot of questions that always trigger your head with. And that's how you are able to become more calm. The moment you become calm, so in cognitive science, we have different brain waves, which are like alpha, beta, delta, gamma, these brain waves. So the moment your thinking processes changes, the brain waves changes. And as these brain waves changes, the different systems of the body from the parasympathetic mode, or they change from the sympathetic part to the parasympathetic side. And there are a lot of other biological changes that come in the body, which helps you to calm yourself down. And in that, it can be dancing, it can be writing, it can be nature, it can be hobbies of cooking, it can be singing, it can be listening to music, any sort of hobby. And I also recommend, because I take a lot of workshops in the schools for the children as well, I always recommend everyone to revive your hobbies. Even though you've grown older, reviving your hobbies will always give you a chance to explore yourself in a different way. And that's what is the art of being mindful. And once you're mindful, your brain waves will change automatically. You will be finding out a way out to come out of your problems. And that is one of the beautiful elements that God has gifted us. And
So,
that's what I have to say. Thank
Dr.
you.
Amrita, I then want to ask you and Rajiv a question. If your mind or your body is not hydrated, you are dehydrated, and you are not aware, will anything then work? Shouldn't one be also careful in the state of the body before the mind is taken care of?
Yes, definitely. There are many conditions of the body's nutrition and hydration, which brings about brain fog, brain confusions. There can be a lot of hormonal states. There can be dehydrative states. There can be electrolyte imbalance, maybe sodium imbalance, or there can be a lot of other situations. I think Dr. Anukul also aligns with me, and Dr. Rajiv also aligns with me, and Dr. Dhanada as well, where these kind of states are the common states where people have these kind of confusions, as well as deliriums and many other situations. And so keeping yourself hydrated, having an optimized diet, your gut microbiome makes a big difference to your mental state as well. So
when
that can never be forgotten.
When Krishna and Arjun were there, we
Mhm.
don't know the exact date, but 3,000 to 5,000 years back, there was no science of water composition. There was no the advanced technology that we got was never there. So do we agree? Do we all agree that if before we take any spiritual holistic approach, biologically body has to be stable enough to take spirituality and holistic methods?
So there are two things here I would want to mention, that our mind or brain needs two things, which is same hierarchy, and we talked about it, Nil Kumar, previously. Number one, oxygen. Number two, water. That's what body needs. And then number three is food or glucose. So it is the same hierarchy. If you're oxygen deprived, you see sometimes, when you has stress, your oxygen consumption is high, and therefore the decision-making power, executive function is poor. On the other way, taking deep breath, anulom vilom, simple thing. Bhastrika is so powerful because it increases the oxygen supply to the brain, and your mind suddenly start working better. It is proven in medical science that with these practices, there is a significant improvement in the decision-making capacity, in the executive function of the brain, and also functional MRI changes and the vascular supply, because you have got that. And the second part, as you mentioned, is the water, because dehydrated brain can't function well, because water is the second necessity. A well-hydrated brain has got thinner blood, which can be supplied to the cells in a much better way, and it can convey the functions, and therefore that actually gives a better way of connecting the neurons together. The signaling is much better if it is hydrated, because in the cells, the communication channel is fluid, and the electricity flows through the water, through the neurons, because all the brain is the wiring of the brain is electric. So all thought process is connected through the neurons, and that generates the electricity, and that conveyed through all body. So if that dehydration happens, this whole function become poor. So just to reiterate the point that you need good oxygenation, you need good water, and you need some glucose for brain to function well. And this is the same hierarchy: oxygen, number two, water, number three, glucose. Thank you.
Well done, Dr. Rajiv Gupta. So that is correct. And you can't live, generally, a body cannot survive without oxygen for more than 3 minutes in general, but certainly not more than 10 minutes anyway. And if you go beyond 30 minutes, you are clinically dead, you are gone. However, you can last without water for 3 days. But you will be dehydrated, and once you are dehydrated, you cannot function. So put your state of mind in a happiness by having clear, clean oxygen. So sadhus and sannyasis were up there in the mountains because the oxygen was the best. The water running on the spinney of the mountain, which is like Creston, where Sharon is, was you didn't have to purify that. That water is so natural, and the sun directly hits you in the morning. So it's no wonder that certain things were so beautiful before than the world which is now. So drink correct amount of water, breathe in. If you are breathing, you are alive. If you can drink water, you are alive. Then maybe work on your mind. Please remove the anger, the hatred, the revenge. This has got no profit on it. So beautiful. We are moving in the right direction. Everybody is thinking in the same level. Thank you, Janada, Amrita, Sharon, Rajiv. Wonderful stuff. Maybe Sharon, it's a time where over the next 7-8 minutes, if you can just go for a qigong, calmness and coolness, let's listen to that and maybe bring some peace in people's mind. And then we'll have last 1 minute from everybody, and then Amrita can sing maybe one bhajan or a kirtan. I think it's nearly midnight in your country, Amrita.
Yeah.
Where
And I think Dr. Anukul is also awake at
Yes,
the midnight.
he's in India as well. Anukul, where are you?
He's in Kolkata.
Oh, in Kolkata. Okay, beautiful. Sharon, let's have some peace of mind through Qigong. Then Sunny can sing and dance to you on that. You need to unmute yourself, Sharon. You need to unmute, please. Thank you.
So let's begin by taking a deep breath in. And then out. And as you breathe out, release any negative thoughts, any pain, any suffering that you're holding in your field. Just let it go and take some deep breaths in and out through your nose, actually. And with each breath, feel the Shakti, the Chi, the Prana enlivening and kind of pumping up your energy field. Feel this breath flowing through your whole body, in and out. Now bring your hands together and rub them together and feel the heat, feel the chi, that heat, and open them a bit and close them. And can you feel there's a kind of thickness, the chi flowing. And then bring them to your knees and focus on your feet. And bring your attention all the way to the center of the earth. Grounding is a very important aspect of Qigong and yoga and many traditional body technologies. So we're going to make a connection between the center of the earth and the kidney 1 point on our feet, which is right in the center of the ball of the foot. It's called the bubbling spring. So imagine that in the center of the earth, there is this pool of liquid chi, of liquid light that's nourishing and nurturing energy. And allow that, see it, visualize it coming from the center of the earth in like streams and rivulets coming up through the earth, like roots, right? Rooting, grounding, and coming up into that kidney 1, that bubbling spring. That point, focus on that point helps relieve anxiety and thoughts in the mind and calms the system. So imagine this liquid light coming up into the bubbling spring through your feet and your ankles and your thighs and your knees, and through all the meridians, up through your calves, into your pelvis, into your spine, coming up the central meridian, the Sushumna, bringing this liquid light of Mother Earth, this healing light. And we often see it as a golden light in the Taoist tradition. And it actually comes up and wraps around your spine, up through your spine, into all your chakras, through your chakra, down through your arms, into the Lagong point right here in your hands, up through your whole, through your throat, through your third eye, all the way up, crown chakra, and around your body. So feel that light coming through you and around. You can do these movements with me. You feel, actually, you gather this light. So you're gathering it down from the earth and you bring it up into your body and then let it open to the sky and receive, stay here for a moment and receive the light of the sky, the light of the stars and Surya, the sun, and feel all that light coming into your body. Open your heart there, relax your shoulders, and then gather all that light and bring it down again through the central meridian, all the way down into opening to the earth. We'll do this a few times. Gather the chi, gather the shakti, gather the light from the earth, and it comes up into your heart. You open your heart to the sky, to the light of the stars. In the alchemical tradition, they say we are made of starlight. And you gather that and you bring it back down through the central meridian, down into your heart, down again to the earth. Breathe in as you gather that light into the heart. Breathe out as you open to the sky, and then bring that light back in and let it sit in the lotus of your heart. Now, then we're going to gather chi again into what's called the three dantians, the three elixir fields. And they're similar in some sense, relate to the chakras, and but they're not seven, there's only three. So the first one, we're going to, from our heart, gather the energy, the chi from the all around us, from nature, from everything around us. We're going to be gathering the chi and then bringing it into our third eye, into our upper dantian, and feel that light spreading and through our mind, through our thoughts, and bringing them a new energy, a new vitality, a clarity and focus. And we're going to do that a few times. So you're going to open your heart, open all of your being to the light of the universe, to the light of the earth, bring it into your third eye and feel it there. And then we're going to take your hands and with that, release any negative thoughts, any issues, any problems down into the earth. And then we're going to again gather the chi, bring it in, feel it energize your third eye, your eye of gnosis, your eye of wisdom, and then release any thoughts, any negative issues. Release them, let them go into the earth. Earth will compost them into new light. And then we're going to take gather that same chi, that same revitalizing energy, and bring it in to the middle dantian, into your heart. And feel that light spreading through every channel of your heart. 16 channels going into 24, etc. So you feel that in your heart, that light nourishing your heart. And then you take that, and again, you're going to now release any suffering, any heartache into the earth. You're just going to let it go, let it go. So we'll do that a few times. You're gathering this revitalizing, just nourishing and nurturing chi into your heart, the light of the mother, as though imagine that the great mother is holding you in her arms and nourishing you and nurturing you like all the wonderful mothers of this earth. So we'll do that once more. We'll take open and gather the chi into your heart. Breathe that nectar into your heart, and then release any negativity, any pain, any suffering down into the earth. And now we're going to bring it into the lower dantian, the elixir field, the place of really grounding. It's like 4 fingers below your navel. Here, we're going to bring it in, gather it, feel it, bringing new light and new energy into your whole being, and so that you have this centered, grounded. You can even at this point really again feel that light coming up from the center of the earth through the kidney one, the bubbling spring, and then into your lower dantian. And then again, release any pain and suffering from your lower body into the earth, release it. And then again, gather the chi. Gather the chi, bring it in. Feel that warmth flowing through this entire elixir field. Feel that chi, feel that light, feel that grace. And then let that go. And then we're going to take our hands and we're going to gather the chi from all around, from the earth, from nature, from the sky. We're going to gather the chi. Then let it flow through our whole body. And feel it enliven not only the physical, but our full energy body. Bring it in. And then we're going to bring our hands down and gather the chi from the earth all the way. Feel as though you're creating a protective shield around your body. And once again, bring that energy through and down through your whole being. Again, feel that chi, feel that energy, feel it in your fingers. You can feel it all the way through your fingers. You know, you can imagine your Durga or Shiva, and you're making that flames, those flames of energy, those protective flames that surround them, all around you. And then bring your hands down into the namaste. And close your eyes and feel that light, those flames of energy, those flames of Shakti, those protective field all around you. So if you're ever feeling like somebody is, sending negative energy at you, you just feel that field and feel not only, the chi is protecting you, but you can even connect with Shiva or Durga or even Mary, any of these deities. That's what that field is. That's a light body. That's a protective field. That's what it is symbolizing. So that's a little qigong from my perspective.
Thank you, Sharon. And yes, wonderful. And now nearly time to conclude. Dr. Lakshmi Vyas is here. Sarah is there. She was also enjoying this evening, so she was having a bite to eat. She is now cool and happy. Anukul is there in India, which is coming to midnight. Amrita's time coming to midnight. So Dr. Lakshmi Vyas, did you feel that energy?
Of course, Sharon, you did wonderful. I mean, it was a very long session, and you perceived and you explained it very well, and your movements were also very good, and the last couple of phrases that you did was really very peaceful and very very good in the mind.
Thank you.
Excellent. I should say it's an excellent work. It was a long work. It was a couple of it took almost about 10 to 15 minutes, and you did very well.
There you are. Thank you, Dr. Lakshmi Vyas. Sarah, you are smiling, Sarah. How did you feel?
Yes, I was taken away to another plane somewhere else. It was lovely. Thank you very much. Yeah, appreciated it. Really great. It's just being in the mindful moment, isn't it? I think that's what really makes the difference, is just being just there in the present and just absorbing what's there right now. So yeah, thank you so much for that, Sharon.
I think that if we could start our day with some form of like this, a qigong or a yoga, or even just breathing exercises, it will help us through the entire day. And then when I go to sleep, I do some pranayama before I go to sleep, just to again clear my mind, clear my body. And I think that that's these practices that we all know. As Dr. Rajiv, was working so hard to bring all this together. Think of how, if we could teach this just even to children in the schools, like our dear friend, Bill Douglas wants to do, these practices, how it could transform all of us and bring us greater health and happiness. Just simple things that we know from the traditional science.
Thank you, Sharon. Thank you, everyone. So it's time to conclude today's episode. I'd like to especially thank today's episode producer, Professor Rajiv Gupta, for bringing us all together, for making this episode really a good success, as well as we start up. I would not say this is the end, it is the beginning, actually, for a new journey. And thanks to all the experts who have joined us, and especially Sharon and Sarah Mills and Dr. Anukul. You have been awake since so long, and Dr. Manisha, Dr. Dhanada, as well as other guests, Dr. Sunny, and also Dr. Bhushan Patwardhan, who has been with us. Meeta ji, it's always good to see you. And thanks to our technical director, Nishit Bhai, who has been with us all the way long, and our founder and director, Neil Kumar. It's time to close today's episode with a short mantra. Om. Om Bhurbhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Bhurbhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Bhurbhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Shanti.